Our YouTube channel is CLRG UP_NCPAG. And please do not forget to like, comment, and subscribe. For updates on our webinar topics and schedule, please ring the notification bell. Again, please test your speakers. Again, while waiting, please test your speakers. We will be playing a piano music for us to know if our speakers are working well. If you can hear the piano music, that means your speakers are working properly. If not, then your speakers have problems. So please send a message in the chat box and our technical support team will be helping you. After all troubleshooting options have been exhausted and you still cannot access Zoom or its audio, as I mentioned earlier, you can live stream the webinar via the links provided in our chat box. And for other questions on troubleshooting, please do not hesitate to send us a message and we will gladly assist you. We will be starting in 2 minutes. For the last time, please test your speakers. We will be playing music, and please make sure that you can hear that music. If you don't hear the piano music playing, then that means your speaker is not working properly. In that case, please send us a message and we will help you through our chat box. We will be starting in 1 minute. Again, please test your audio. If it's not working, you may visit our Facebook, our website, or our YouTube channel for the live streaming. Our YouTube channel is CLRG UP_NCPAG. Do not forget to like, comment, and subscribe. For updates on our webinar topics and schedule, please ring the notification bell. We will start in 1 minute. In disasters and emergencies like the spread of the coronavirus, the vulnerable conditions of the marginalized groups, such as women and children, are amplified. In our response, it is therefore important to take into consideration the situations and the risks that these sectors face. Local government units are well situated to respond to the gendered impacts of COVID-19 at the community level. The question is, how does the health crisis affect women and girls differently? What can local government units do to adopt an inclusive, rights-based, pro-women approach in local COVID response? As for the children, they are not only at risk of contracting the coronavirus, they also face a number of other risks and issues during the quarantine period. What are these risks and how can they be mitigated and managed? Ladies and gentlemen, I am Don Jeffrey Cabral and welcome to this webinar on women, children, and health crisis management at the local level. Today, we will bring you two researchers from the Center for Local and Regional Governance and two experts in the field to share with us their research, thoughts, and insights on these two topics. Now, let me brief you with what's going to happen in the next few minutes. Please direct your attention to the slide shown on your screen. In the next 10 minutes, we shall hear some opening remarks and discuss the flow of the webinar. We shall also be discussing some house rules or protocols. At 2:10, we shall hear our first presenter for the first topic, and she will be presenting for 30 minutes. Her talk will be followed by a 15-minute reaction. After that, we shall have a quick break, and we will resume at 3 o'clock. At 3 o'clock, we shall have the second topic. The speaker will be presenting for 30 minutes, 3:30 to 3:40, and 3:30 to 3:45, we shall hear our reactor. After that, we'll be having a 30-minute open forum. So that would be from 3:45 to 4:25. Please note that we will be prioritizing the questions sent during the registration period. If time will allow, we shall also entertain questions from the chat box. So at any time, you may post your insights and your questions in the chat box. Let's see if they can be accommodated later. After the open forum, please stay for some closing remarks and final reminders. We target to end the webinar at 4:30. As I mentioned, this webinar is brought to you by the Center for Local and Regional Governance, also known by its acronym CLRG. It's one of the three research and training arms of the National College of Public Administration and Governance, or NCPAG, and it is the University of the Philippines Research, Training, and Consulting Arms or Consulting Center for Local Governments. On this slide, you will see the various topics that our past research studies covered. To name a few, we had studies on sustainability, DRRM, local governance, regional autonomy. And speaking of DRRM, if you have been checking our Facebook page, one of our researchers has just co-authored a policy paper on the use of social media among LGUs in responding to the ongoing pandemic. And this topic will be discussed in one of the webinars that we have scheduled this year. You may check it out on our website and our Facebook page, along with our other webinar offerings. Aside from research, training is also one of the key functions of the center. We offer regular and customized training programs for executive officials, legislative officials, department heads, and staff, and in some cases, even private citizens interested in the field of local governance. Shown on your screen are a few pictures of the trainings that we have conducted. Our work does not end in research and training. We help local governments, government agencies, and even non-government organizations in determining solutions to the concerns that they have. For example, we have studied and presented our findings on local mechanisms for the delivery of programs and services for our PWD brothers and sisters, and on the various ways how local government units can better prepare and respond to natural calamities and hazards. For example, the El Nino phenomenon. Okay, so sino-sino nga ba ang mga participant natin ngayong hapon? We are expecting 247 participants joining us through Zoom, our website, and our YouTube channel. Manggagaling ang mga ito sa 32 probinsya mula sa iba't ibang panig ng Pilipinas at kasama rin dyan sa bilang na yan ang Kalakhang, Maynila. The group is composed predominantly of females, 70%. Males account for 27%. We have other webinar participants who identify themselves as non-binary, cisgender, bisexual, and some did not provide this information. Organization-wise, most of the participants are from provincial, city, and municipal government units. We also have NGOs, members of the academe, and representatives from local and regional offices and national government agencies. So shown on your screen are the designations or the positions of the participants. We have school administrators and members of the academe, LGU officials, police officers, social welfare and development officers, planning and development officers, admin personnel, legislative staff, students, and NGO officials. I know you're eager to hear this afternoon's presentations, but before that, here are some protocols that we want to be followed. Participants are in mute mode. This is to make sure that only the speakers are heard and the background noise is minimized. Please maintain the mute mode throughout the session. Ideally, cameras should be on all throughout the session for verification of identity and participation. But of course, we recognize the signal and bandwidth limitations in some areas. So we may only be requiring participants to turn on videos at some points during the webinar. Don't worry, I'll be announcing those the time when the videos should be turned on. But of course, if there's no problem, it's okay if your cameras are on for the entire duration. The webinar is recorded, and while the webinar is ongoing, we expect that all of us will be paying attention to the speakers. We know that most of us are inside the comforts or inside our homes, so please avoid unnecessary activities that may distract our fellow participants, especially if your cameras are on. Eligible for certificates are participants who have number 1, registered, number 2, participated, and number 3, submitted the feedback form. One last note, though we have tested your audio earlier, it's not impossible that you may still encounter audio problems later. You may at any point comment on the chat box and we will gladly answer and help you. The webinar will run continuously even while we are troubleshooting your problems. As I said, the CLRG is one of the arms of the National College of Public Administration and Governance, or NCPAG, of the University of the Philippines. And today we are honored to be joined by the Dean of the College. Here to give his opening remarks, I'd like to call on Professor Dan A. Sagiel. Dean?
Okay, thank you, Don. Magandang hapon po sa ating lahat. Welcome to the Center for Local and Regional Governance webinar on women, children, and health crisis management at the local level. I would like to start by wishing you and your families my best for your health and safety in this time of COVID-19. I would also like to express my gratitude to Professor Alice Celestino and the staff of the Center for Local and Regional Governance for hosting this event. More important, I am happy for the CLRG for continuously sharing the results of their researches and in contributing to the management of our public affairs. This webinar is very timely and relevant. As COVID-19 pandemic, a public health emergency continues its disruption, the operations of our organizations, from family to businesses, have been threatened. Many businesses have already indicated that they could not continue business operations if another round of stricter quarantine is enforced. Entrepreneurs are facing many obstacles, including ensuring the businesses they have put their blood, sweat, and tears into continue to stay afloat. On top of that, many of them have employees that they are trying to protect and reassure, a difficult task when they themselves are struggling with burnout. This is deeply unsettling. A crisis like this requires quick thinking in the face of uncertainty. However, with such high stakes on the line, we find ourselves dealing with analysis paralysis or the inability to make decisions due to overthinking. Delaying decisions will only lead to more problems, and those problems will require more decisions. Decisions in this kind of situation are never final, for the simple fact that change is never absolute. This disease outbreak affects girls and boys, women and men differently. While children's health appears less impacted by COVID-19 than older adults, Children's education will be interrupted, protective structures disrupted, and their families and communities placed under stress by health and economic burdens. Children are also at risk of psychological distress at times of crisis, as well as increased risk of violence, abuse, exploitation, and neglect. COVID-19 increased girls and young women's duties, caring for elderly and sick family members, as well as for siblings who are out of school. Girls, especially from the marginalized communities and with disabilities, may be particularly affected by secondary impacts of the outbreak. Economic challenges during the outbreak pose a serious threat to young women's work and business activity and expose them to increased risk of exploitation and abuse. Girls and young women facing severe economic shocks are more likely to take on high risk work for their economic survival. LGUs are well suited to respond to the gendered impacts of COVID-19 at the community level. Fortunately for us today, we have resource speakers who have first-hand information on and experience in managing COVID-19. Using what they have already learned and created can save a lot of time and resources, increase our productivity, and minimize risk. To get success in using the knowledge, it is important to have a good knowledge base and content, and it should be easy to find for the members of our offices. We have to make adjustments. We must continually motivate, encourage our constituents to keep safe and healthy by observing COVID-19 protocols. We must be abreast with COVID-19 developments, and most important, we must be effective in dealing with issues and challenges. We must improve our capability to continuously deliver quality services. Together with this, we must find ways so that there will be some degree of normalcy in our lives and livelihood. We hope that this exercise will be an effective exercise for sharing information to support and promote COVID-19 response by generating relevant and up-to-date information and sharing of experiences. I am certain that CLRG will be more than willing to provide assistance to you. I sincerely hope that the lessons learned in this webinar will assist all of us as we address the COVID-19 scourge. Again, before concluding, allow me to thank all of you for your interest in this webinar. I trust that you will find this exercise to be a rewarding experience. Maraming salamat at magandang hapon po sa ating lahat.
Ladies and gentlemen, that was Dean Sagil of the National College of Public Administration and Governance. I think we are ready for the next topic, or I think we are ready for the discussion proper. So we shall be covering two topics. The first topic shall be, okay. The first topic will be, okay, we shall cover two topics. The first topic is gendered approach to local COVID-19 management. The second, protecting the Filipino children in time of COVID-19 pandemic, some risk mitigation measures. Our speakers are two university researchers from CLRG and are reactors experts in the field. I will be introducing them formally later. So our first speaker joined the CLRG as university researcher last year. She has organized she has organized customized training programs for some local government units and served as case writer, training facilitator, and resource speakers for the center's training programs. Previously, she has worked as defense researcher with the Philippine Navy and as a planning officer with the Philippine Competition Commission, where she helped develop organizational management systems and gender and development policies and initiatives. She obtained her Bachelor of Arts in Political Science from the University of the Philippines, and she's currently completing her Master of Public administration program of the here in NCPAG. To talk about the policy brief she wrote for the center entitled Gendered Approach to Local COVID-19 Management, here is Ms. Michelle Castillo. Ma'am Mitch?
Thank you so much, Sir Don. Thank you, Sir Dan, also for opening this webinar, and for that, actually, Sir Dan gave us a very good overview of what we're going to discuss this afternoon in our two topics. Let me also acknowledge and thank our CLRG colleagues and interns joining us this afternoon. We have LGUs, Ms. Jean Enriquez, who will be our reactor later. We have participants from the PNP, the Interagency Council on Violence Against Women and their Children, and the National Youth Commission. So welcome po sa ating lahat. Magandang hapon at salamat po for joining us this afternoon. So let's maximize the time that we have. I have 30 minutes to share with you gendered approach to local COVID-19 management in the Philippines. Now let's begin with the end in mind. Why gendered approach? Ang gusto po nating i-drive na main point sa discussion na ito ay the government should adopt a gendered approach in its COVID-19 response. Ito ay dahil sa mga health risks and impacts kasama na ang physical, social at economic na impacts ng pandemic ay mas matindi po para sa mga kababaihan at iba pang marginalized na grupo. Yes, matindi para sa lahat. The pandemic is indeed unprecedented, and it has been said over and over again, no government was really prepared for it, not even more advanced states. Pero ang epekto ay mas matindi sa mga marginalized na grupo dahil sa mga existing na inequalities sa ating lipunan bago pa man po dumating itong pandemya. Isa man po tayo sa may pinakamataasang ranggo pagdating sa gender equality, mataas pa rin po ang discrimination na nararanasan ng mga kababaihan pagdating sa iba't ibang institusyon gaya ng pamilya, physical integrity, access sa productive at financial services or resources, at civil liberties. At ito po yung pinaka-premise ng ating discussion ngayong hapon. Madalas po kasi na i-ignore sa response sa disaster at even sa health risks, health emergencies ng government, ang gender dimension. So ang assumption kasi, pare-pareho ang experience at epekto ng disaster, ng crisis, at itong pandemic sa iba't ibang grupo. If the government fails to include the gender dimension in its response, mas titindi pa ang risks at impacts sa mga marginalized na grupo. And this will drive them further into marginalization. At ang epekto nito ay hindi lang po habang tayo ay nasa crisis, kundi yung effect na would be felt well after the pandemic has abated. As I mentioned a while ago, local government units are strategically situated in implementing interventions that consider the differential impacts of the pandemic, especially to women and girls. Hence, sa discussion po natin ngayong hapon, we will focus on what can be done at the community level. In the next 30 minutes, I will share with you gendered impacts of the COVID-19 pandemic, the gender perspective in national policies on disaster response and crisis management, and this question, gender blind ba ang COVID-19 response ng gobyerno? And how can we make gender more visible? What are recommendations that LGUs can adopt to make their COVID response more gender responsive? So let's now discuss the first topic, gendered impacts of this pandemic. What do we mean by gendered impacts of the COVID-19 pandemic? Ang ibig sabihin po, nagkakaiba-iba ang epekto ng pandemic depende po sa kanilang gender. Pero kung physical at social ang pinanggagalingan nito. Physical or biological dahil may mga sakit na natural na iba ang epekto sa babae at lalaki dahil po sa genetic makeup, sa ating biological makeup. Social dahil po sa gender roles. Ito po yung mga roles or behaviors na expected or associated sa isang tao, depende kung siya ay babae or lalaki. So halimbawa, ang pag-aalaga ng bata ay female role, habang ang decision-making at leadership madalas associated sa kalalakihan. So ano-ano po ba yung mga gendered impacts itong pandemic sa mga kababaihan? Una, there is a higher risk of exposure given that majority of the frontline workers in health and social sector are women. Mataas ang risk ng exposure. Globally, female workers constitute 70% of health and social sector workforce. Sa Southeast Asia naman po, 79% ng nurses ay babae. Sa Pilipinas, 90% ng mga health workers natin ay mga babae din. So ikalawa, may increased burden of domestic caregiving. Habang mas marami ang kababaihan na kasama sa health workforce, madalas din na ang responsibilidad sa pag-aalaga ng mga bata sa mga may sakit na miyembro ng pamilya at sa mga nakatatanda ay nasa babaeng miyembro ng pamilya. So itong responsibilidad na ito ay lalong bumigat po ngayong pandemic. Dahil sa community quarantine at pagsasara ng mga eskwelahan, mas nadadagdagan ang oras na kailangang ituon ng mga magulang para sa pag-aalaga ng mga bata na hindi na pumapasok. Isama na rin po natin dito yung burden ng homeschooling. So nadagdagan din yung responsibilidad ng mga kababaihan yung mga nagbibigay ng caregiving sa bahay dahil sa home quarantine policy para sa mga halimbawa bumiyahing locally stranded individuals, sa mga asymptomatic na pasyente, at even dun sa mga mild na symptoms, cases ng COVID, na dahil wala nang bakante na COVID facilities, sila sa bahay nila nagpa-quarantine. So dahil dito, tumaas po yung risk ng exposure para sa mga kababaihan nag-aalaga ng mga COVID patients sa bahay. At idagdag pa natin yung responsibilidad kung sila ay employed, whether they are working from home or pumapasok sila sa opisina o sa trabaho. So ito pong multiple burdens na ito ay very taxing sa mga kababaihan, hindi lang physically, pero emotionally and mentally. At ang epekto ay long-term sa kanilang holistic well-being na maaaring malampasan pa yung pandemyang ito. Sabi nga ng mga experts, ang susunod na pandemic ay sa mental health naman. Ikatlo po, may increased cases of domestic violence and other forms of sexual and gender-based violence dahil sa pandemic and sa mga community lockdowns. Isa po ito sa mga pinakaseryoso at pinaka-urgent na epekto nitong pandemic. Dahil sa community quarantine, maraming mga babae at mga bata ang napipilitang manatili sa loob ng bahay at delikado po ito sa mga nakatira kasama ng mga abusers nila or ng mga violent partners nila. Arguably, naging effective ang community quarantine sa pagbago ng pagkalat ng virus, at least for the first few months. Pero isa sa mga negatibong epekto nito ay ang pagtaas ng kaso naman ng violence against women and children. Noong unang buwan ng pandemya, naglabas na po ng maraming statements, warnings, guidelines, yung iba't ibang grupo, kagaya na po ng United Nations Women, tungkol sa probable na pagtaas ng VAUSI cases, particularly domestic violence na tinatawag ng shadow pandemic. Bumaba man yung risk ng gender-based violence na nangyayari sa workplaces or sa schools dahil nga nasa bahay na yung marami sa atin, doon naman po tumaas yung risk ng gender-based violence. So bakit po may pagtaas ng cases? Isa sa mga epekto po ng community lockdowns at mass quarantine ay napabawasan ang kapasidad ng mga kababaihan na biktima ng pang-abuso na tumakas at makahingi ng tulong. Bago po ang pandemic, challenge na ang underreporting. Kaya hindi talaga natin alam gaano ba yung magnitude ng gender-based violence sa bansa. At mas mahirap pa ang situation ngayon na community quarantine tayo. Mas tumataas din ang tendency ng mga abusive partners na maging violente. Nagiging coping mechanism nila ang controlling behavior at violence sa harap ng stress at uncertainties na dulot nitong pandemic. Mas nagiging confident yung iba na hindi sila mare-report dahil nga bawal lumabas. At dahil sa disruptions din ng social services, gaya ng paghalimbawa walang hotline or sarado yung mga VAUSI desks o yung mga women's desks. Yan. So isa pa pong risk sa pagtaas ng sexual and gender-based violence ay yung mga risk na nanggagaling na perpetrators from the security forces. Nakikita natin yung prominence ng ating security forces, including the PNP and the AFP, sa community quarantine ng gobyerno. Without sufficient sensitization and adherence on the part of the law enforcement personnel and other government personnel who are in charge of the lockdown, cases of sexual and gender-based violence may also rise, lalo na po halimbawa yung mga homeless na kababaihan o yung mga kababaihan na nag-seek ng help from their abusers if they're taken to temporary shelters, and even yung mga nahuli na violators ng curfew at community quarantine na i-detain natin sa prisons and holding facilities, very much at risk po sila. So with all due respect po sa ating men and women from the PNP joining us today, may mga pag-aaral na po na sa paggamit ng security forces sa mga humanitarian and conflict situations. Related daw po ito sa pagtaas ng gender-based violence. Sa mga pag-aaral sa mga nakaraang health outbreaks kagaya ng Zika at Ebola sa Africa, yung mga communities po na kung saan security forces yung ginamit para magkaroon ng surveillance, Ayun, nag-report po sila na marami po yung nakaramdam ng takot dahil sa excessive use of force and violence. Susunod po na gendered impact, ito po, dahil sa magnitude ng pandemic, malaking bahagi ng public health system natin, of course, nararapat na itoon sa COVID-19 response, kasama na yung detection and treatment, isolation, testing. Pero isa po sa mga unintended na epekto nito ay posibleng disruption at pagbawas sa pondo para sa regular na sexual and reproductive health services. Maaari din pong mabawasan yung pondo, yung personnel, dahil ibubuhos nga po sa emergency response. Ayon po sa Commission on Population and Development, noong April, naglabas po sila ng statement na maaaring tumaas po ang bilang ng mga unplanned pregnancies. At ito po kasi yung madalas na nangyayari sa mga kaso ng natural calamities kapag ang mga pamilya ay napipilitang magsama-sama sa mahabang panahon sa loob ng bahay. Sa kaso po ng mga teenagers, pwede rin pong tumaas ang teenage pregnancies dahil din po sa sexual violence. Para naman sa mga buntis at nursing mothers, may risk po na kaakibat yung pagpunta nila sa mga hospitals or clinics para sa check-up nila or whenever they have to avail for health services. Maaari rin maging limited yung availability ng mga gamot at treatments para sa mga sensitive at high-risk pregnancies. Yung mga buntis naman po at mga nursing mothers na nakakontract ng virus, maaaring pong maging at risk yung mga children nila for infection. So ngayon, babalik tayo dun sa burden of care. Paano pag sinanay yung nagkasakit? Paano pag sinanay ang breadwinner? Malaki ang snowball effect sa pamilya. And this burden po is magnified lalo for poorer households na hindi po maka-afford to hire additional help. And those yung mga communities na cut off from support systems, yung mga hindi nila makontak or makasama yung mga relatives nila who could have helped them out in taking care of the household while the mother is recovering. Susunod din po na gendered impact, ito po sa economic impacts on women. Malaki po ang impact ng unemployment, lalo na po sa kababaihan. Nung dito lang pong July, naglabas po ang PSA na umabot na po ang unemployment rate natin to 17.7% or 7.3 million na unemployed na Pilipino. Malaki po ang impact nga nito sa mga kababaihan, lalo na po dun sa mga economically dependent sa kanilang mga kamag-anak, yung mga involved sa unpaid family work, although kasama po sila sa bilang ng employment rate, ano? Again, they are economically dependent sa ibang member ng pamilya nila. At dahil sa unemployment at economic downturn, maaaring bumaba yung kita ng mga negosyo ng pamilya nila, maaari ding mawalan ng trabaho yung mga kamag-anak nila. At dahil dyan, they have to look for alternative sources of income. They may have to be dependent on the emergency cash relief of the government and those that are given by other organizations. At mas mahirap pa po lalo ang sitwasyon ng mga kababaihan na nasa informal sector. Bago pa man po ang pandemic, limited ng access nila sa mga economic opportunities and sa government financial institutions. Vulnerable po sila sa exploitation and poor working conditions. At dahil po sa community quarantine restrictions, mas nalimitahan ang kanilang economic activity. At lalong lumiit po yung kapasidad nila na mag-avail ng mga grants, loans mula sa financial institutions. And finally po, for the gendered impacts, meron pong mga multiple and intersectional vulnerabilities sa iba't ibang grupo ng mga kababaihan. Hindi po monolithic ang mga kababaihan, magkakaiba rin ng experiences and vulnerabilities dahil po sa magkakahalo at madalas ay naging intersect ng mga factors gaya ng socio-economic status, age, ethnicity. Ayan. So magkakangit lang po ako ng ilan sa mga vulnerabilities na ito na dulot ng pandemic sa iba't ibang grupo ng kababaihan. Ang mga negatibong epekto ng pandemya, mas magnified, mas matindi para po sa mga kababaihan na nasa refugee camps or those who are internally displaced dahil po sa conflict, yung mga nakatira doon sa mga post-disaster recovery stage na mga areas, or doon sa mga malalayo, yung mga very isolated na mga areas. Dahil po sa madalas ang healthcare system sa mga lugar na ito, lalo na po sa mga post-recovery stage, decimated na po yung kanilang healthcare system. Limited din ang income opportunities nila from the beginning at mataas na po ang incidence at even risk ng sexual and other gender-based violence. Ganun din po yung experience ng mga women who are deprived of liberty. Alam naman po natin na siksikan talaga yung ating mga kulungan at lalong mas naging siksikan ngayon dahil doon po sa mga naaaresto sa paglabag ng community quarantine. So ang taas po ng risk na sila ay mahawa lalo na pag may nag-positive po sa loob ng kulungan. Malaki din po ang epekto ng mobility restrictions or yung travel restrictions ng community quarantine para po sa mga kababaihan na may kapansanan at sa mga persons living with HIV na kailangan maka-access halimbawa ng medical assistance. Nandun din po yung possibility ng discrimination or yung ma-sideline sila sa ayuda ng gobyerno, yung madalas po nito yung mga indigenous women, yung mga peoples living with HIV, yung mga survivors ng human trafficking, yung mga nasa urban poor communities, yun. Maaari po silang mabypass kasi probably yung iba hindi registered na botante. And malaki rin ang epekto po sa kanila lalo kapag na-disrupt yung mga basic social services ng gobyerno. Ang mga kababaihan na nakatira sa mga deprived areas, na walang alternative sources of income, maaari rin po na sila ay mapilitan na pumasok sa prostitution para po kumita. So para po matugunan itong mga gendered impacts na ito sa kasalukuyang pandemya, present na po, meron na po tayong mga national policies and tools in place para gabayan yung ating LGUs and other government agencies and instrumentalities para sa kanilang response. At ito po yung susunod nating tatalakayin, mga policies that mandate the gender perspective in national policies on disaster response and crisis management. So i-highlight ko lang po sila, we will not go through all the details, but just so you can appreciate that the policies are really in place. And they can provide specific and definitive guidelines for our LGUs. Una po yung Magna Carta of Women, or Republic Act number 9710. So some of the salient points na related po sa disaster risk reduction and management, nire-require po ng Magna Carta for Women yung participation ng kababaihan sa national, regional, and local coordinating councils. Required din po na mangolekta at gumamit ng sex disaggregated data and reproductive health indicators. Required din po na mag-provide ng relief goods na may kasamang sanitary packs and minimum initial service package for reproductive health. Ayan. Kinakailangan din po na maglabas ng mga measures regarding prevention of sexual and other gender-based violence sa evacuation centers halimbawa. And dapat involve po ang mga kababaihan sa mga evacuation centers na ito sa iba't ibang camp communities. Yan. So next po ay ang Disaster Risk Reduction and Management Act of 2010. So sinisigundahan po ng batas na ito yung mga provisions ng Magna Carta for Women, of Women. And yung mga iba sa mga salient points na nandito sa DRRM Act, ayun, required po na yung ating mga local disaster risk reduction and management offices at barangay disaster risk reduction and management councils, they should provide immediate delivery of food, shelter, and medical supplies for women and children. They have to endeavor na mag-create ng special place where internally displaced mothers can breastfeed, can take care of their children, and give support to each other. At required din po na yung inyong head ng Gender and Development Office ay miyembro ng Local Disaster Risk Reduction and Management Council. Ayan. So ito po yung mga policies, guiding policies, and meron din pong tools from the Philippine Commission on Women. Meron po tayong Harmonized Gender and Development Guidelines. Checklist po ito para sa NGAs, LGUs, para ma-ensure na yung kanilang DRRM plans and projects are gender sensitive and gender responsive. Para po sa LGUs natin, meron po tayong Gender Responsive LGU Assessment Tool or yung GIRL. Sana po familiar kayo dito at sana nagamit niyo na rin po ito, ano? And meron din po tayong Gender Mainstreaming Evaluation Framework. So ito pong mga tools na to, very helpful po sila para ma-ensure natin na yung mga projects natin, and especially now during this time of the pandemic, our responses are gender responsive. Okay? Now, specific to the context of the COVID-19 pandemic, I want to highlight two policy issuances that frame the crisis from a gender perspective. And they highlight the gendered impacts of the pandemic. And some of them I've alluded to the discussion earlier. And I will be mentioning the measures later in the last part of the discussion. Una po, yung Philippine Commission on Women, Memorandum Circular number 2020-03. Inilabas po ito noong April 2020. It applies to national government agencies para po sa revision and implementation ng inyong mga GAD plan and budget. And you're enjoined here to implement programs, projects, and activities that really focus on gender issues and concerns for you to be able to address them. So naglista din po sa memo ng mga measures na maiging i-adopt ng mga agencies na ito. And for the level naman po ng local government units, ayan, naglabas po ang Commission on Human Rights and Department of Interior and Local Government ng Joint Memorandum Circular. Nilabas po nila ito nitong July, and this policy comprehensively frames the crisis using a gendered lens, and they provide definitive guidelines para po sa LGUs para ma-ensure na yung inyong COVID response ay gender responsive, gender sensitive. Ito ay akma para sa pangangailangan ng vulnerabilities ng iba't ibang grupo, at hinighlight po nila dito yung survivor-centered response to all forms of gender-based violence. So I hope that our LGU participants were able to go through all these two circulars, because nandito po yung pinaka-reference sa mga measures na dapat niyo pong i-apply para po sa inyong COVID response. Now let's go to this question, the reality. Despite the fact what we can arguably describe as strong policy framework promoting gendered approach in disaster response and crisis management, there are studies that shows that it's not always the case na yung plano actually address the gender-related concerns arising from disasters. And the current pandemic may also reveal the lack of institutionalized practices and applications of gendered approach in managing crisis, at least for the first, let's say, 2 months nung nag-declare po ng community quarantine policy ang gobyerno, no? Gender and women are conspicuously invisible in the framing of the COVID-19 crisis and in the majority of the policies that were formulated at the national level. So, except for the 2 that I already mentioned, meron pa pong 3. So, I was not able to update, this slide. But there are 5 out of 44 na review namin na policy issuances that highlight the gendered impacts of the pandemic. The rest are gender blind. Majority of the policy documents, they need no mention of gender or women. And in terms of the Bayanihan to Heal as One Act, the President's report to the Joint Congressional Oversight Committee only started dedicating a portion on assistance on women, children, and other vulnerable groups nung kanyang ika-9th na report noong May 25, or 2 months after the law took effect. Yung kaso ng number ng VAUSI cases, first na nai-report ito noong June 1, which is the 10th report, and last na isama sa kanyang 12th na report noong June 15. So ongoing pa po itong pag-aaral na to, pero for now, it's a good question to ask. Is the national government response gender blind? Again, except for the 2 memorandum circulars that I highlighted a while ago, majority did not even mention women gender. They only mentioned women kasi part ng target na beneficiary pregnant women. Okay? So isa po ito sa mga challenge sa context ng health crisis, yung tinatawag na tyranny of the urgent. Women and gender issues are put aside in favor of the immediate biomedical needs. Dahil sa emergency nature ng crisis, sa kakulangan ng resources, limitasyon sa kapasidad ng mga ahensya, na isasantabi ang pangangailangan ng mga kababaihan. So, nung start po, marami na pong naglabas ng mga statements, warnings na halimbawa maaaring tumaas ang number ng violence against women and children. Ayan. So ngayon, nakikita na po natin na kung una, risks at warnings lang sila. Ngayon, nangyayari na po. Diba? So, babalitaan naman po natin yung pagtaas ng VAUSI cases at tumaas yung pag-report, not during the community quarantine, pero simula nung nag-ease yung lockdown. Lumabas din yung isang issue tungkol sa Sex for Pass na scheme, kung saan may mga miyembro ng kapulisan natin na nagbibigay ng quarantine pass kapalit ng sex. At nagkaroon din ng isang kaso ng rape slay ng isang teenager sa Ilocos ng suspect mismo ay kapulisan at may alegasyon na nagkaroon ng pagkukulang sa response ng personnel na naka-assign sa women's death. So these are cases. We are not saying that these are representative of what's really happening, but it's again good to ask and good to check. Is tyranny of the urgent, is it the one governing our response right now? So punta po tayo sa level ng community. Ano po ang pwedeng gawin ng ating mga LGUs para gawing mas visible ang aspeto ng gender sa kanilang mga COVID response? Sir Don mentioned a while ago, actually this presentation is largely based on a policy brief which was written in April, and it has been updated based on the recent issuances. At based on those, review po ng mga statements, review ng mga policy briefs, review nitong mga circulars na ito and previous literature din, meron po tayong tatlong recommendations. Una, LGUs should recognize women's leadership and ensure women's participation. Ikalawa, we should prioritize women's multiple and intersectional vulnerabilities. At ikatlo, we should adopt efficient and evidence-based LGU response. So puntahan po natin isa-isa. Una, women should have a choice or voice in the decision-making process sa COVID-19 response. Maaaring po na ang representation ng mga kababaihan ay through women who have positions in the LGU, like the local chief executives, or through participation and consultation with women's groups. Meron lamang po tayo sa Pilipinas ngayon from the last election, 23% ng lahat ng total elected positions ang nakaupo ay kababaihan. Pero we see na sa ngayon may mga female local chief executives who are rising to the times, and we hope na sana mas marami pa. Maigi rin po na ang LGUs ay magkaroon ng gender balance sa local COVID-19 task forces nila at yung kanilang mga barangay health emergency response teams. Sana rin po represented yung mga kababaihan mula sa vulnerable sector at yung mga local low-income communities sa inyo pong mga decision-making bodies. We want to highlight na since women form the majority of the medical and social frontline workers, sana po isama talaga sila sa decision-making process ng LGU. Maigi rin po na sumangguni ang LGU sa mga gender experts at makipag-partner po sa mga civil society organizations na ang advokasya ay rights at welfare of women. Sa dami po ng responsibilidad na nakaatang sa LGU, alam po natin na hindi talaga kakayanin. Marami-marahil ay kulang sa expertise or technical know-how, kung paano maayos at systematikong pag-aralan ng crisis from a gendered lens. Kaya nariyan po ang mga gender experts natin, gaya po ng mga accredited na ng PCW sa kanilang school. Makakatulong din po sa inyo, sa mga LGUs natin, yung mga women's groups dahil po sa kanilang karanasan at knowledge sa kung sino ba yung mga pinaka-vulnerable, sino po ba yung pinaka-affected nitong community quarantine. Alam nila, dahil they work with them, alam nila yung specific challenge na sa face, ano yung mga limitations, ano yung mga naging epekto sa kanila, ng mga limitations imposed by the community quarantine, ano yung mga social and health services that they urgently need. And these are relevant information na kailangan po ng LGU para ma-prioritize po ninyo yung mga sectors na nangangailangan at ma-tailor fit yung interventions na kailangan niyo pong i-implement. Likewise po, itong mga grupo na ito, they have political capital sa mga communities where they work with. And LGUs can use this as leverage to ensure cooperation and the participation of the community. And these organizations, these NGOs, civil society organizations, women's groups, they can provide our LGUs with immediate feedback on how responsive yung kanilang mga projects and interventions pagdating po sa pangangailangan ng kanilang community. So itong mga feedback na to, makakatulong po ito sa inyo para po magkaroon ng rectification, adjustments sa inyong mga response. And I'd like to add na sana po instead of blocking the efforts of the civil society organizations and other private organizations, not necessarily yung pag-block as in pag-stop, minsan po nakaka-hinder po yung sobrang regulation, sobrang daming mga requirements. Ayan. Instead of doing that, I hope that LGUs can highly consider working with them, partnering with them so that you can find innovative solutions, programs, and you can augment yung limited resources ng LGU, yan, makakatulong po sila sa inyo. So work with them instead of blocking their efforts. Next po, LGUs should address sexual and gender-based violence. These are some measures that we want to recommend to our LGUs. Set up hotlines to report domestic violence and other forms of sexual and gender-based violence. Maigi po na itong mga hotlines na ito or mga other platforms ay accessible, lalo nga po ngayon sa travel restrictions na meron tayo. Isaalang-alang po natin yung importance ng data privacy, yung access po nila. So halimbawa, kung telepono po ito, consider nyo po yung mga mobile na numbers na pwedeng tawagan or even online. Ayan. Provide temporary shelters and psychosocial support for abuse women and girls, the survivors of this abuse. Dapat ang mga shelters na ito ay women-friendly, hiwalay ang kwarto, yung mga CR, pasilidad para sa lalaki at mga babae. Dapat po may mga naka-assign na female personnel sa mga checkpoints, temporary holding areas, precincts, and quarantine facilities. Maigi na sila ay trained at oriented sa kung paano mag-respond sa mga sumbong ng gender-based violence, kaya ng harassment and abuse, lalo na kung ito ay nangyayari sa mga facilities na ito. Isama din po natin ang sexual and gender-based violence, isama natin yung risk of online sexual exploitation, isama natin ito sa ating awareness campaign ngayong community quarantine. At dahil din po sa malaking posibilidad na ang pang-abuso ay ginagawa mismo sa loob ng tahanan ng mga kamag-anak, maigi rin po na magsagawa ang LGU ng Community or Neighborhood Watch. Alalahanin po natin, challenge na po ang underreporting even before the pandemic. So lalo na po na mas mahirap ngayong community quarantine. Next po, on sexual and reproductive and other health services. Kung kaya po ng pondo at depende po sa pangangailangan ng mga pamilya, kaya po importante ang datos. Maigi po na maisama ng LGUs sa kanilang ayuda or relief packages, yung family planning commodities, medicines, hygiene products, including menstrual kits, ayan, and infant and adult diapers sa relief packages. Gawin po nating accessible itong mga commodities na ito ngayong maraming travel restrictions gawa ng community quarantine. Hindi po mag-work na hihintayin natin silang pumunta sa health center para mag-avail. Maging proactive po tayo. Maiging i-prioritize po ng LGU ang maternal health care, kasama na po yung infection prevention, para po sa mga buntis na mga nanay, sa mga sensitive pregnancies, and even sa mga pregnant women na may HIV or suspected or confirmed COVID cases. Siguraduhin po natin na bukas ang mga birthing clinics, mga maternity wards at iba pang pasilidad para sa mga pregnant at nursing mothers. Kung kaya po ng pondo ninyo, sana po maidagdag sa ayuda yung mga supplies para sa pregnant and nursing mothers, yung mga makakatulong po para sa kanilang kalusugan and kanilang nutrition. Ito po mga serbisyong ito, sana po maigi na maisama rin po sa maibibigay natin sa mga women deprived of liberty, sa mga provincial and city female dormitories or local police precincts. Kasama na rin po yung mga kababaihan na nasa refugee or mga refugees, mga IDPs, mga internally displaced persons na nasa evacuation center. Patuloy pong suportahan sana ng LGU ang mga persons living with HIV. May restrictions na po sa kanilang movement dahil po sa stigma at lalo na po ngayon, mas malilimitahan pa po, lalo na po yung access nila sa kanilang treatment. Yeah. Next po, safety nets for adverse economic impacts for women. Our social amelioration program should have been targeted and should include women in the most vulnerable situations, particularly women who are solo parents, breadwinners, working in informal sectors or economies, women with disabilities, survivors of human trafficking, and elderly women, women in urban poor communities, and those who are in rural and mga distant and mga remote na mga islands ng ating bansa. So, dahil hindi po kasama sa identified na recipients ang ating mga persons living with HIV, maganda po na i-consider ng ating LGU na isama sila sa supplementary SAP na beneficiaries. And we highly recommend na for LGUs, you can adopt cash for work initiatives that benefit displaced workers, women from the informal economy, yung mga repatriated natin na OFWs, survivors ng human trafficking. Ayan. So makakatulong po ito sa kanila, yung mga Cash for Work initiative. Next po, for our frontline workers, siguraduhin po natin na yung mga temporary shelters and accommodations for our health workers and other frontline workers are women-friendly. May separate facilities and rooms para sa lalaki at babae. Ensure po natin na nare-receive nila yung kanilang nararapat na sahod, yung kanilang benefits, yung kanilang hazard pay. Bigyan po natin sila please ng kumpletong PPE. We cannot overemphasize the need to protect them from contracting the virus. Isama din natin sa PPE yung lalo na po sa mga kababaihan na frontline workers, yung sanitary materials for menstrual health. Ayan. Maigi rin po na sana may mga facilities where they can manage their menstruation with safety and dignity. Ayan. Bigyan din po sana natin ng support system ang ating frontline workers na responsible din for caregiving at home. Maaari pong magbigay ng practical assistance, gaya po ng paghahatid ng groceries or pinamalengke, mga supplies, para po sa kanila and even sa mga single mothers na hindi po makalabas dahil walang magbabantay ng mga kamag-anak, ng mga kanilang mga anak. Bigyan din po natin ng assistance sa mga kababaihan na involved sa unpaid care work, gaya ng Cash for Work program. Maigi rin na isama sa information campaign ng LGU na himukin yung ibang miyembro ng pamilya nila na tumulong sa pag-aalaga ng mga bata at nakatatanda at may sakit sa bahay. Bigyan din po natin ng karampatang guidelines at support paano mag-alaga ng mga confirmed or suspected COVID patients na naka-home quarantine. Para po ma-minimize yung risk ng exposure para sa caregiver. Bigyan po natin sila ng guidelines na higit pa dun sa normal na sinasabi ngayon na physical distancing, proper hand washing, kasi obviously, hindi po ito sapat sa mga may direct contact sa mga COVID patients, lalo na po dun sa mga naka-home quarantine. Next po, gumamit po tayo, mangolekta po tayo ng sex disaggregated data, and this should be used to inform our medical response, yung safety nets, and social amelioration program. Mandated po ito, gaya ng nasabi ko kanina, mandated po ito ng ating batas na mangolekta, gumamit ng sex disaggregated data. But the reality is, hindi po madalas na nasusunod. Ang mga nauna ko pong mga naimungkahi, lahat po sila angkla, mas magiging madali kung meron pong sex disaggregated data ang LGU. So, halimbawa, yung number ng frontline workers na babae, single mothers, women sa informal sector. Yan. You can also use, of course, your community-based monitoring system, and tanongin niyo po yung inyong mga GAD offices or yung inyong mga GAD desks tungkol dito sa sex disaggregated data na ito. Yan. Meron din po tayong gender-sensitive COVID-19 online dashboard na pwede niyo pong magamit. Dinevelop po ito ng National Research Council of the Philippines, Department of Science and Technology. Nakakatuwa po na meron tayo nito. Kasi globally po, hindi po lahat ng bansa actually nangongolekta ng sex disaggregated data tungkol sa COVID. So parang meron lang ata mga 45 plus, less than 50 countries. And isa po ang Pilipinas sa meron nito. And so gamitin po natin ito, naka-disaggregate siya, pwede siyang gamitin ng mga LGUs for your decision making, policy making. And finally, bawasan po natin ang red tape at patronage. Habang mas tumatagal po ang response, mas tumitindi ang negatibong epekto ng pandemya at restrictions ng community quarantine sa mga vulnerable na grupo. So halimbawa po sa SAP distribution, maiging siguruhin ng LGUs na ang proseso, ang saklaw sa inyong mandato ay maikli at walang unnecessary steps na mas makapahirap pa yung mga beneficiaries. Make it easier for your constituents to avail your services. So provide them transportation. Consider going house to house. Kasi nung time po ng distribution ng SAP, ang daming lumalabas sa news na pinapila, pinalakad, pinapunta pa, even the elderly, even yung mga with disabilities. So please consider the restrictions that the government has imposed upon your constituents and work around those restrictions. Consider the limitations such as their age, their disabilities, yung proximity, yung layo or lapit po nila sa mga pasilidad ninyo. Further, in this time of crisis, LGUs, especially local elected officials, please set aside the widespread patronage system in determining recipients of cash and relief packages. please ensure po na yung prioritization ay talagang nakabase po sa needs and vulnerability ng members ng inyong community. And sana i-form po ito ng evidence, I cannot overemphasize sex disaggregated data, and sana na-determine through consultation. At nakalagay din naman po ito sa guidelines ng ating gobyerno. Dapat nakapublish yung list ng beneficiaries para po sa transparency. And so magandang tanong yan. So far, gaano ba ka-gender responsive ang LGU response to COVID-19 pandemic? Present ba ang gender dimension or gender blind ba ang mga action sa local level? So, meron po kaming ongoing na ginagawang pag-aaral. So far, we did this survey, may 20 po na sumagot mula June 8 hanggang July 27. We asked them questions and we assessed their response based on 6 areas: women's participation, gender analysis, response to sexual and gender-based violence, sexual and reproductive health services, economic response, and communication. And the LGUs were scored based on the presence or absence of the indicators for each area. And the scores were weighted to generate a rating on a 10-point scale. So on average po, ang rating po ditong 20 na LGUs na sumagot na ito ay, okay, so next slide po. Okay. On average, the LGU's COVID-19 response can be described as slightly gender responsive, but much more can be done, especially in the areas of women participation, sexual and reproductive health, economic response, and inclusion of the gendered impacts of the pandemic in their awareness campaign. So again, ongoing pa po itong study na ito. We hope that we can improve the instrument that we use and get more responses from our LGUs. But so far, we can do more. So dyan po nagtatapos ang aking discussion. I apologize for going over the time, but I'd like to close with this message na I believe that the virtue underlying what I've shared with you this afternoon is really that a virtue of genuine compassion and genuine concern for the members of our community. I hope that our LGUs, our government agencies, at hindi lang naman po sa kanila nakaatang, of course, yung responsibilidad. Tayo rin po, and even those who are in the civil society sector have a role to play. But having compassion, having the sincere desire to serve, yun po yung panggagalingan ng lahat ng to. Matutulungan po natin yung mga nasa vulnerable na mga grupo, yung mga marginalized sector ng ating lipunan, kung totoo pong meron tayong compassion and desire to serve them. So with that po, again, maraming salamat sa pakikinig, and I turn you over to Sir Don.
Okay, thank you, Ma'am Mitch. I hope everyone can hear me. Thank you, Ma'am Mitch, for your comprehensive presentation. So, as she discussed, while COVID-19 or any health emergency does not discriminate who will be infected, there are differences in the way that the health crisis affects men and women. And so therefore, there are gendered impacts of the pandemic, particularly to women and girls. So binanggit niya, higher risk of exposure, increased burden of domestic caregiving, increased cases of domestic violence, and other forms of gender-based violence. Limited access to healthcare is also one. And limited access to reproductive health services, loss of income and livelihood, and increased hardships for women in vulnerable situations. So she stressed that our local government units are in good position to respond to these gendered impacts at the community level. And so I hope that our participants, especially those from the LGUs, listen to the points she raised as to how LGUs can optimize this position to address this impact. So let me just echo what she said. No, she said that we should avoid being gender blind, and we should overcome the challenge on tyranny of the urgent and still include other concerns that are as legitimate and timely. Bawasan din daw po sana ang red tape and patronage system, and of course, make gender more visible. So Ladies, that was Miss Michelle Castillo. Ma'am Mitch, thank you very much. At this point, we shall hear a reaction to the presentation. Our reactor is the Executive Director of the Coalition Against Trafficking in Women Asia Pacific. She was awarded in 2010 by the then Philippine President as one of the outstanding women in the nation's service. Ito yung tinatawag na Towns na award. And as one of the 7 modern heroes of 2011 by Yahoo Philippines. She is accredited as Gender and Development Resource Person of the Philippine Commission on Women. She has gained extensive experience as resource person and trainer for various international and national fora on trafficking, prostitution, and other forms of violence against women, gender issues, women's political participation, among other topics. She has been invited to speak on women's issues in 34 countries. Among others, she chaired the Commission on Trafficking in Persons during the World Conference Against Racism held in South Africa in 2001. Ladies and gentlemen, our reactor, Miss Jo Enrica Enriquez, or Miss Jean. Miss Jean?
Thank you so much, Dawn. I would like to express our deep appreciation as well for the comprehensive review by Mitch from a gender lens of local government management of the pandemic in the country. I will be giving just 3 thoughts on the gender impacts, and I collapse 10 thoughts on the policy frameworks and LGU responses. So I will give this in bullet points because I don't really have time given the 15 minutes to elaborate on each. My first point in general is that while this discussion is focused on local responses, I believe it is important for all of us to note that national policies and pronouncements have impact on both the gender impacts and the LGU's effectivity in responding to gender needs. Because this has been a resounding feedback to us of local governments that we have been working with before and during the lockdown. In terms of gender impacts, my first point is that while the pandemic magnified gender inequality, we also have to be very sensitive to the class differences, even among women, because we have received reports of families in gated communities receiving relief packages, but those in the urban poor areas have been left out, as Mitch already mentioned. And this has been repeated reports to us in the weeks following the lockdown. So it was not only in the beginning, but it has persisted. So we ourselves have delivered or needed to deliver relief packages to the communities because the most vulnerable of them were not able to receive the basic necessities such as rice. Kaya marami dun sa mga amin pong mga community, nilulugaw na lang nila yung bigas na aming nabigay kasi nga ay hindi napakahirap i-extend at kami lang ang nakarating sa kanila, and this is supported by evidence. My second point is that in relation to the cases of VAW, so we all know that there's that after crisis or during crisis, there are observable increases in all forms of violence against women. But the problem is that there was lower reporting. If we compare the first quarter reports to the PNP Aling Police shared with us by our partners in the PNP Women and Children Protection Center, which perhaps reflect difficulty in accessing help for those who are abused. I'm happy, or we are glad that the cases were underscored, especially even by police officers. I don't think that we should be silent on this, and even of course, the PNP WCPC is disturbed that these are happening. So it's important that at the national level, we have this responsive unit, which is the WCPC in the PNP. because the women that are victimized by the police officers are directly organized by us. We also appreciate the CHR gender portal and particularly the Gender Equality and Women's Human Rights Center of the CHR that has been very responsive to cases that we bring to their attention. Thirdly, on gendered impacts, it's true that there's now a double-digit unemployment in the country, and for women, even if they are employed, it's doubly, multiply hard because they also cannot report to work because of lack of transportation. So this is one of the national policies that I'm pertaining to, which is the prohibition of PUJs to be able to operate. And these are the most accessible mode of transportation for the poorest of women. So I hope that we can look at the most vulnerable among the women. In terms of policy frameworks and LGU responses, I just want to mention that as early as April 2, the DILG, even before the joint memorandum circular that was released this July, on April 2, DILG released an advisory to say that barangay vow desks should be active. Now, the challenge here is that many of the vow desk officers were not trained on survivor-centered response. Similarly, their principals, the barangay captains, aren't trained on survivor-centered and gender-responsive approaches to all forms of violence against women, including violence to the LGBTQIA. So that's a hindrance. A lot of barangays also were saying that they don't have transportation to bring victims to the hospital because they were burdened by relief distribution. This should not be acceptable because vow response is life-saving. It is equally important as giving the relief packages. So what we have contributed as CSO, especially in the vulnerable areas of Mindanao, was to bring awareness. We put stickers on alcohol bottles that are being distributed, which indicated hotlines of local PNP, WCPD, and other such frontline responders to violence against women. And even during the pandemic, we conducted teletrainings for vow desk officers in Mindanao, and this is with the help of the United Nations Population Fund. And also for our LGU responders. I'm mentioning this because this can be perhaps something that can be emulated in other areas. So chinaga po namin yung pagbibigay ng mga training sa mga responders sa pamamagitan ng telepono at patuloy kaming nagbigay ng technical assistance sa kanila. We can't really say that there's a lack of institutionalized gendered responses because we have established protocols during Yolanda and other similar crises that could have been adapted as well, such as pre-positioning food prior to lockdown, hygiene kits, and others. And we know that COVID has come to our awareness late last year. So there could have been greater preparation, especially given lockdown limitations. I would like to mention that there are LGUs that are able to respond. In Mama Sapano, for example, they were able to access binhi or vegetable seeds early in the year that they were able to distribute to farmers. Also, I would like to mention Pasig, which was able to provide transportation for HIV positive persons so that they can access antiretroviral drugs, which is not true for many other LGUs where we have been helping HIV positive survivors of prostitution. In terms of national policy, this is what I was mentioning earlier, the Balik Probinsya could have been better thought of because LGU partners of ours are concerned that many of those who came to the provinces don't really have livelihood. It's very, very difficult to provide them with livelihood that's sustainable at the moment. So because of long quarantine requirements, some of those who were quarantined actually escaped from the quarantine centers. I have 4 more points. I would like to commend Mitch Mitch's emphasis on the participation of women CSOs in planning, monitoring, and implementation of crisis responses. It's also important to emphasize the elimination of patronage system in relief distribution and even provision of livelihood programs. So I have one more. Okay. Just one more. So I saw the mention of female local chief executives, but I think what's really important, whatever sex or sexual orientation, gender identity and expression, the important thing is that they are trained and they have internalized gender responsive approaches to the crisis. Thank you so much. I'll end there.
Okay, thank you very much, Miss Jean Enriquez or Miss Jean. She mentioned the challenge na nakukuha nila so far, may lower reporting on the violence against women cases. Good thing there's the CHR gender portal. She iterated the problem on unemployment among women, which I think has been ongoing for a long period of time kahit nung wala pa tayong pandemic. As for the policy frameworks of local government units, she mentioned that in April 2, naglabas na daw ang DILG ng kanilang advisory on barangay vow desk. And she said that there's a need to train barangays on survivor-centered and gender-responsive approaches. So maybe our local government units can help our barangays in the conduct of these trainings. She also mentioned good practices, among them the practices done in Mama Sapano and in Pasig. She said that the Balik Provincia could have been better thought of. So I just hope that this program of the government can be adjusted or improved further based on the learnings that we have gotten so far from the experiences of the Philippines during this pandemic. So again, thank you, Ms. Jean Enriquez. So that's it for the first half of the webinar. Let's have a quick break. Let's have a break for 3 minutes. So please be back after 3 minutes. Okay, tayo'y nagbabalik sa ating webinar. Naku, mahirap palang uminom ng kape na inoorasan ka ng 3 minuto. So, for the second part, ang ating topic ay, okay. Bago tayo pumunta sa second topic, nais kong I had and Michelle Castillo at Enriquez. May mga tanungan sa itong so may isulat ang inyong questions sa ating chat box at ang mga questions o kaalaman na meron kayo na gusto niyang i-share sa chat box. Titingnan na may dagdag na banggitin ang mga ito sa ating open forum. And for the second half, we shall be discussing the topic protecting the Filipino children in time of COVID-19 pandemic, some risk mitigation measures. Our speaker on this topic is also university researcher of CLRG. She obtained her Master in Business Administration at De La Salle University, Manila, and earned her Bachelor of Science in Custom Administration at PIGES. Prior to joining CLRG, in marketing industry. In CLRG research has been in strengthening the council for the protection of children. So with us her discussion paper on the topic that I mentioned. Here is Miss Marie Christine Chan Tayo. Ma'am Marie.
Thank you, Sir Don. Well, good afternoon, everyone. Thank you for joining us in today's webinar, despite that it's holiday today. So you actually gave time para pa rin maka-attend dito sa webinar namin. So again, I am Marie Christine Tayo, a researcher of CLRG, and I will be presenting my discussion paper entitled Protecting the Filipino Children in Time of COVID-19 Pandemic, Some Risk Mitigation Measures. The basis of this paper is more on related literature that I have collected from the web since Metro Manila was declared under enhanced community quarantine. When that was actually when I did this discussion paper. So I decided to write on the risk of our children that are facing during this pandemic, since the news have only been focusing on protecting them from COVID-19 and their education. Protecting and ensuring the welfare of the children and the youth is essential during this COVID-19 pandemic. Hindi lang dapat sa disease natin sila maprotektahan, kundi pati sa kanilang education, mental health, kaligtasan nila from physical abuse and exploitation ay dapat ma-ensure din natin. We should be more aware on these issues. So we will be discussing the risks the Filipino children face in this pandemic and proposed measures to mitigate these risks to protect and promote their welfare. So let's begin. The COVID-19 pandemic has compelled the Philippine government to place the entire Luzon and other provinces under community quarantine. For Metro Manila, enhanced community quarantine or ECQ was implemented. Social distancing measures were strictly observed, and there was limited mobility of the people that placed restrictions on normal public activities. Skeletal workforce and work from home arrangements were done both in the public and private sectors na naka-affect sa operations ng businesses ng government and ng government agencies din. Mass gatherings tulad ng religious activities, concerts, movies were also prohibited, and closure of schools at all levels was mandated then. As of July 27, 2020, that was this Monday of this week, out of the total 82,040 cases of COVID-19, 5.5% are from the age bracket 0 to 17 years old or yung minors natin. So that's roughly 4,500 cases, which is yun pa rin yung pinakakaunti from the total number of the cases recorded. And as you can see, majority of the cases are from the 31 to 45 years old age bracket, followed by 18 to 30 years old age bracket. Our children may not be that affected sa virus, maybe because the government has acted early by keeping our children safe by suspending classes and not allowing them to go out. So, what exactly are the risks and issues faced by the Filipino during this pandemic? In a snapshot, here are the identified risks that the Filipino children are facing during this pandemic. One risk that they face is on their nutrition and physical health. Attention was brought to proper hygiene and basic sanitation conditions of households in the Philippines. Major risks that was highlighted during this pandemic is our children's education because of the sudden suspension of face-to-face class as social distancing measure. Majority of the schools in our country, both public and private, are practicing traditional method of teaching, which is yung face-to-face or yung classroom method. And only a few exercise yung mix ng classroom and online class or module-based method of teaching. Third is about our children's mental health. Disruption on our daily routine and the uncertainty of this pandemic has caused adults and children makaramdam ng sadness, nervousness, confusion, and of course, takot. And also being stuck in your house can cause uneasiness. Kasi hindi naman talaga tayo sanay na magkulong or magstay sa bahay natin buong araw, di ba? And last but not the least, our children's safety and security, both online and offline, are at risk. Our children are at risk from online predators when our children are, of course, when they are online, and some children are at risk being stuck with their abusers in their own house. So now let's take a look on each risks and issues faced by the Filipino children one by one. So for health and nutrition, the COVID-19 pandemic highlighted proper hygiene and basic sanitation conditions of households in the country. Kasi ang number one dapat gawin to avoid being infected by the coronavirus is through frequent proper hand washing with soap and water. So according to the Philippine Statistics Authority, in 2017, there's 89% daw ng household sa Philippines may tubig at sabon para sa hand washing. 6% has access to water and 2% has no access to water and soap. However, their data did not show how frequent yung paghugas ng kamay ng mga members ng household with both soap and water. Kailangan maituro natin sa mga bata yung proper hand washing, which is yung paghuhugas ng kamay for at least 20 seconds to keep them safe from contracting and spreading the coronavirus. In the same survey, sinasabi rin doon na 76% of the households in the country use improved toilet facilities, which is a good figure. Improved toilet facilities, yun yung toilets na hindi common CR, meaning may sariling toilet yung pamilya sa sarili nilang bahay. Ibig sabihin, may less interaction sila sa ibang tao kapag gagamit ng CR and less chance din na makontaminate sila ng waste ng ibang tao. Based sa data, there is a good number of improved toilet facilities in the country, including the presence of water and soap for hand washing. So this means that Filipinos are particular din naman when it comes to cleanliness and sanitation, which syempre is a good thing. So children's nutrition during this pandemic is also an area of concern. Since the ECQ was implemented, there has been a slow movement of goods and services because of the different checkpoint procedures in each province, municipal, and city level. Therefore, supplies of fresh and healthy food are not accessible as before. May kanya-kanya silang protocols, diba? Kung ano yung kailangan i-present. Because of the scare of total lockdown and limitation of mobility, due to suspension of mass transportation and curfew, and of course, sa takot of being exposed sa virus, marami ang nag-stock ng canned and other preserved goods na mas mahaba ang shelf life. Of course, to secure their own food supplies that would last for about 1 month. We all know that canned and preserved foods are less healthy than cooked meals from fresh meat and vegetables. Frequent intake of canned or preserved foods can cause health risks not only to children but to us adults as well. Kaso, stocking up on goods is not feasible across all types of households then. Yung middle-income families or yung families with members who are regularly working in the formal economy have better means to buy medicines and food supplies than low-income families during this pandemic. According to the 2015 Family Income and Expenditure Survey, 58.4% of the population belong to the low-income class. So it's more than half ng total population natin. So most of them work in the informal economy sector, and during this pandemic, sila yung considered na pinaka-affected given their no work, no pay situation. Although sila ang priority ng government na bibigyan ng relief goods and cash assistance, relief goods from local government units most often include rice, instant noodles, and canned goods, which are considered unhealthy. Although there were few LGUs, especially in sa provinces, that were able to include fresh food supplies in their relief packs. But from the name itself, relief packs are mostly good for up to 2 weeks for a family of 5. Maubos din ang ayuda and magkakaroon ng araw na magugutom sila dahil wala silang kinikita, and therefore, affected din ang nutritional intake lalo ng mga bata. Furthermore, due to the limitations on physical activity due to ECQ and social distancing, physical and mental health and overall development is also affected. The pandemic should not stop the LGU health workers to continue in providing vitamins and vaccines to children. Kasi if hindi matuloy ang pagbibigay ng bakuna, this can cause to another outbreak ng isang sakit na preventable naman na dahil na existing na siya ng bakuna. Education. Education has been one of the hot topics ngayong pandemic. Kasi nga, biglaan ang suspension ng classes because it was the measure taken to slow down the spread of the virus. And this disruption of normal school activities together with transition to new modes of learning affect the education and development of children in different ways. To ensure that the education continues, many public and private schools transitioned to online learning. The Department of Education, or DepEd, opened access to the DepEd Commons to private schools as well to help them during the quarantine period. Some colleges and universities that are mostly in the second semester of the academic year also transitioned to online classes, while some decided to end the semester early. However, this online learning was urged to be suspended through a petition of students and faculty from top schools in the country. Maybe because due to some factors. One, online learning, because of the economic situation of the country, hindi lahat ng students may access sa mga kakailanganin para sa isang online class, tulad ng internet connection, personal computers or laptops, smartphones, and other electronic equipment. Pangalawa, hindi libre ang internet connection sa bansa natin. Internet packages are costly, kahit pa may mga prepaid packages, pero yung data allocation sa package, baka hindi naman sapat para sa isang 30-minute na online class. Kasi online classes would require video talaga. Syempre, attendance, and the teacher would want to make sure na present yung estudyante niya. And moreover, there are problems on the reliability, stability, and speed of internet connection in the country. Third, availability of conducive environment for learning. Online learning sa panahon ngayon ay pareho ng home learning, which require not only internet connection and equipment, but it would also require a learning space inside the home na conducive sa pag-aaral, meaning walang distraction sa mag-aaral. And this is less visible in low-income households because of poor housing condition. Panghuli, parents or guardians would be too busy worrying about what their family will eat daily or kung saan makakakuha ng pambili ng pagkain or sa paghahanap ng financial aid or para naman sa mga nasa middle income household. Yung mga magulang may be busy doing work from home na madalas sinasabay pa nila sa household chores, kaya they would have limited attention and capacity to supervise and homeschool their children. Sa mental health and other issues, school closure and social distancing have caused disruption to everyone's daily routine. Kapag nasira ang daily routine natin, we would feel sad, nervous, anxious, and it would trigger our mental health negatively, lalo na for those who already have existing mental health issues. Mitch mentioned earlier na mental health nga daw will be the next pandemic. Children with mental health issues can worsen because of the pandemic as they face anxieties and distress. And because of limited access to mental health support dahil sa community quarantine measures. Though dumami naman ang available na online and hotline mental health support, but still, not everyone with mental health issues are comfortable with this type of intervention. Meron pa rin na mas comfortable and mas gusto nila yung face-to-face intervention. As for the children with special education needs naman, they are generally characterized as being short-tempered when their daily routine gets disrupted. And most of these students attend occupation and speech therapy sessions. Again, dahil sa pandemic, cancel din ang therapy sessions nila. Online intervention would not be enough for this kind of therapies because having a professional occupational or speech therapist to oversee the child's therapy session is different pa rin since parents or guardians are not that fully equipped with the knowledge on how to do the therapy on their own. And most kasi ng ganyan is they would give instructions to the parents lang. Though I know there are clinics na nag-open na for face-to-face sessions, but syempre, some parents are still not comfortable of letting their children go out because takot nga sila na baka ma-infect ng virus yung anak nila or sila mismo. If ma-stop ang therapy, this would be a hindrance in their progress in development or could cause regression, which the parents and therapists would not want to happen. Apart from the cancellation of classes and transition to online classes, meron tayong college students na stranded naman sa dormitories nila. And the fact na stranded sila, dagdag stress ito sa kanila, no? So, dagdag pa din yung pag-aalala nila sa sarili nilang health and living situation. Inaalala din nila yung families nila since they are far from each other. And apart from that, the students always also would worry about their food and daily supplies since there are limited establishments where they could buy their necessities, lalo na around their dormitories. They could not go out to get funds from their allowances in their bank accounts or remittance centers kasi nga suspended ang public transportation ng ECQ. Add-on stress din yung lack of stable and reliable internet connection para makakomply sila with their academic requirements. Having to worry about the said situations would really affect the students' mental well-being because of the sudden stress factors. Now, for safety and security, well, of course, for some parents, having their children stay with them at home during the pandemic is the safest place where their children can be because hindi lumalabas yung mga bata, nasa bahay lang, and they get to be with them and see them 24/7. However, this is not always the case. There are also a few safety and security risks for children staying at home during community quarantine. Some children who have the means are spending more time online without the proper guidance of the parents or guardians. And this increases the risk of the children to online sexual exploitation or cyberbullying because our children can access sites or gaming applications that can be used by sexual predators to victimize children. Apart from the online risks, the crisis also increases the children's risk for domestic abuse, physical or sexual. Being forced to stay at home, violence within the family may increase, and this may be due to the increased anxiety because of the pandemic, or it is already a recurring incident at home. And since bawal nga lumabas ng bahay ang below 21 years old, many abused children are forced to stay at home with their abusers and have limited chances na makatakas from human traffickers. Mas hindi sila makakahingi ng tulong sa kapitbahay dahil nasa loob lang din ng bahay ang mga kapitbahay nila, hindi rin makalabas. And sadly, there were news na parents mismo ang nag-exploit sa mga anak nila. So, now we will be discussing yung recommendations. So after the risks, here are some recommendations on how to address or mitigate the risks that our children are facing that can affect their overall well-being. First, for health and awareness, since availability of sanitation facilities in household is tied with the economic conditions, Children that belongs to poor households have limited access to sanitation facilities. A government intervention can focus on increased access to water supply and most especially soap. Similarly, the LGUs can include hygiene kits in the relief packages they distribute. As to increase health awareness naman, the government can work with the LGU, especially the barangay councils, to develop child-friendly messages on COVID-19 for the children to better understand the situation about the virus and how to be safe from it. Child-friendly campaign can be done online through the LGUs and or barangay council's official media account since marami sa mga kabataan natin ngayon ang may Facebook, Twitter, and usually yung mga telcos natin, they offer free data access to these social media sites. To have better reach din ng audience aside from the online campaign, offline campaign can also be done through the barangay's public address system and distribution of informational flyers to reach those who do not have smartphones or any access to social media. The flyers can be designed then in a friendly manner, more on visuals rather than texts, para mas madali nilang maintindihan. Tas recommendations naman on education and mental health. For online learning to be effective, first and foremost, our educators should be trained properly on how to conduct or facilitate online classes. Likewise, they should be given proper tools to be able to conduct online classes. Proper tools like, of course, laptops, internet connection, trainings. However, online learning may not be feasible in remote or rural areas where there are problems on internet connectivity and lack of equipment. Apart from learning online, television can be an alternative mode of learning for the elementary and junior high school level. Television networks can be encouraged to air educational shows during weekdays, which pwede panoorin ng mga bata para matulungan sila to better understand lessons even without the physical presence of a teacher. Since television digital boxes is a thing now and are now available and more affordable, networks can come up with a digital channel, especially catering educational needs of our children. The government can work closely with television networks on how to go about this transition in learning method. For rural areas with slow to no internet connection or poor television signals, proper training should be done again for our educators for formulating modules for take-home lessons and tasks. Educators should also have constant communication with the parents or guardians of the students through homeschooling. Class advisors can have a database of their mobile numbers, the mobile numbers of the parents or guardians, so they can communicate through SMS. They can also create support groups via Facebook Messenger, Viber, or WhatsApp, so that parents can get support and tips not only from the teacher, but from the other parents and guardians din. Again, para sa rural areas or areas where namahina ang data connection and signal, advisors can do house-to-house round to check on their students and communicate with the parents and guardians para ma-check yung progress ng students nila and ma-assist din ang parents sa pag-guide sa homeschooling. This would address the need of children with mental health issues and special needs since the teachers can visit and check on their students personally. If the children stays engaged with their peers, teachers, and parents, it can help them to further develop their social skills. So now, how do we prepare our children for pandemics? In relation to our children's mental health during this pandemic, parents and guardians also play a huge role to make sure our children are doing okay. As I have mentioned several times already, it is very important that the parents or guardians make the children understand the facts about the virus and how to prevent being infected. As you can see in the slide, there are 3 categories of people and yung role nila para ma-prevent yung pag-spread ng virus. Discussing this to our children would help them better understand why they need to stay at home and isolate themselves from other people. Kasi alam naman natin na ang mga bata gusto talaga nila to be at crowded places like schools, parks, and the likes. At gustong-gusto nila na nakikipaglaro sa mga friends nila. If the parents or the guardians fail to discuss and let the children understand properly yung situation, the children may feel restless and they would feel na going on is unfair kasi they cannot go out and they feel that they are being deprived of what they want to do, which is really not the case. And of course, as parents, we do not want our children to feel that way. Therefore, as parents and guardians, we should be really careful then on how we convey the information to our children. Kung paano sabihin ng mga magulang sa kanilang mga anak ang tungkol sa COVID, doon din magdedepende yung fear level ng bata. And this is a part pa sa information na nakukuha nila from watching TV or sa social media. So we as parents should be careful with the words we use or the tone of our voice when we explain. We do not want them to feel super scared of the situation kasi it would also affect their mental health. Being away from their school, daycares, or routines, syempre our children are feeling helpless and discomfort kasi like us, they do not have an idea when would this be over and when they will return to their normal days. For older kids, it is quite easy kasi they have the maturity level na to understand and to level their anxieties. But the younger ones have lots of questions as to why so much of hand washing is required, when mangyayari sa kanila pa nagkasakit sila, when will they meet their friends again, and so on. And we just have to make sure na ma-address natin properly yung questions nila to lessen the feeling of helplessness and discomfort. Next is how to deal with child boredom. So alam natin yung mga bata ngayon, wala na lang sigurong bukang bibig sa bahay, kundi I'm bored. Ano, wala akong magawa, ang ganyan. So when our children are stuck at home and nothing to do more, they would feel stressed. Parang tayo lang din na adults. But when children are stressed, their bodies respond in a different way, like screaming, hiding, becoming sad, etc. To help them cope with these responses, it is important to acknowledge their feelings and involve them in different activities like first reading books, engaging in arts and crafts, helping in daily household chores, exercise, praying, gardening, writing stories and poems, playing indoor games, and listening stories from parents and or grandparents. And if your child is getting bored, you don't need to feel guilty na hindi mo sila na-entertain. Instead, think about the following. First, check your child isn't just hungry or tired, as everything can feel boring. Baka hindi naman kasi talaga sila bored, baka wala lang silang energy to engage in an activity. Second, there are unusual times na nararamdaman natin na everything is out of our control. No, we can't do anything. So, see how you can provide your child with new day-to-day choices para they would still feel that there is something they can be in control of, something they can decide on. Nare, they get to choose what would be the menu for today, what is for breakfast, lunch, dinner, and kunwari, if bumalik na yung school, they'll online classes sila, in order, what do they want to do their schoolwork? There, they want to do math first, then arts, etc. 3, don't feel obligated or responsible to stop this terrible experience for your children. They can develop internal resources or by being creative, by having to solve the boredom problem themselves. They can surely think of something to stop the feeling of boredom. 4, teach your child not to be afraid of the feelings that come with boredom. Dapat mas ma-feel nila yung excitement kaysa sa takot dahil bored sila. Boredom is a signal that indicates change is needed kasi nga paulit-ulit na lang kaya sila nabubored. So help them generate ideas and then pick one na gusto nila gawin and let them be responsible for their choices. Get them to create a boredom box with ideas that they can choose from. So daily, ayoko na gawin to, they get to choose from that box na kung anong activity nila for today. And last but not the least, our attention is easily stolen by our mobile devices as they provide an easy distraction. Try setting a timer with your family, turn off your devices, pause from work, and all engage in something meaningful for 20 minutes. You can play a game as a family or simple chit-chat or eat snacks together. It is important that we do something with our children every day because it is something they would look forward to. Recommendations on safety and security. When it comes to our children's safety online, the government should take measures to keep children and the youth safe online through enhanced safety features and tools such as antivirus or anti-malware programs. Although social networking platforms are also taking necessary steps to enhance their security measures, since alam naman nila na ito na yung new normal eh. And it is expected that there will be more online modes of learning to be available worldwide. Parents and guardians should be in charge of making sure that their children's devices are safe. So how can the parents make sure their children are safe online? Here are a few tips by UNICEF. So first, keep them safe with open communication. Have an honest dialogue with your children about who they communicate with and how. Dapat aware tayo sa behavior ng anak natin, lalo if they are online. They appear to be upset or secretive with online activities, or if they are experiencing cyberbullying. Work with your child to establish clear rules on how, when, and where devices can be used. Second, use technology to protect them. Check the child's device is running the latest software and antivirus programs, and that the privacy settings are on. Keep webcams covered when not in use. You can put tape on top of it, mga masking tape or paper, let's stick nyo doon. And then we as parents should be responsible for this. If hindi tayo masyado techie, magpatulong tayo sa techie. Research if possible. Kasi during this time, ang magulang talagang unang pwedeng mag-protect sa anak nila from cybercrimes. Turuan din natin yung mga bata to keep personal information private, especially from strangers. Third, spend time with them online. Create opportunities for your child to have safe and positive online interactions with friends, family, and youth. Spend time with your child to identify age-appropriate apps, games, and other online entertainment. Fourth, encourage healthy online habits. Promote and monitor good behavior online and on video calls. Encourage your children to be kind and respectful to classmates, to be mindful of what clothes they wear, and avoid joining video calls from a bedroom. Better if they join video calls sa common rooms ng house like living room, dining room. And familiarize yourself with the school policies and helplines to report cyberbullying or inappropriate online content. Fifth, let them have fun and express themselves. Encourage your child to take advantage of digital tools that get them up and moving, like online exercise videos for kids and video games that would require physical movement. Remember to balance online recreation with offline activities, including time outside if possible. Now, for recommendations then, during this time, the Barangay Council for the Protection of Children, or the BCPC, together with the Sangguniang Kabataan, can make the most out of their mandate to protect the welfare of the children. Apart from the regular vaccinations being done by the community health centers to make sure that the children are healthy and the distribution of relief goods, the BCPC and SK could collaborate in making a thorough check on the children and youth in their community. They can go house to house, gather data on the needs and concerns of the children and their parents regarding their education, health, and iba pang concerns ng children. From the data, they would be able to gather, they can come up with relevant programs and other interventions that may require the help of the city or municipal government and even provincial government if needed. The BCPC and SK should also be more visible and hands-on when it comes to children and youth who violate the curfew or the community quarantine guidelines. To ensure that they are protected from abuse, the BCPC should ensure that proper protocols in handling cases of the children and the youth are observed and followed to make sure that the children's rights are not violated even during this time of pandemic. Hindi porket may pandemic at may Bayanihan Act, pwede na abusuhin ang mga kabataan natin na mahuhuli nila sa pag-violate ng curfew or safety protocols like wearing masks. Well, now to wrap up my discussion, taking care of the children's welfare is as important as flattening the curve of COVID-19 cases. Adults, not just the parents or guardians, but the government as well, should make sure that the children are physically and mentally healthy, safe both online and in their community, and their education should not suffer because of the pandemic. To be able to make sure our children stay healthy and safe, and their education is not disrupted during this time of pandemic, a collective effort among the national and local government private institutions, schools, and most especially the parents and the guardians of the children is imperative. As the saying goes nga, di ba, it takes a village to raise a child. Hindi hindi natin pwede iasa sa gobyerno lang ang pagprotekta sa mga anak natin. Hindi din naman pwedeng magulang lang ang magprotekta sa kanilang mga anak. Tulong-tulong tayo dapat. Proper information dissemination from the government and support from all the concerned stakeholders are critical. Our society should work together as one during this time, not just in fighting the present pandemic, but also in making sure that our children, the future of our nation, are well taken care of. And so with that, I end my presentation and thank you for listening. And back to you, Sir Don.
Okay, thank you very much, Ma'am Marie, for sharing with us your discussion paper and your insights on the topic. So kung mapapansin niyo po, medyo hinihingal yung ating speaker. The topic she discussed is actually very close to her heart because in a few months from now, she will also be a mother. So, okay, so again, thank you, Ma'am Marie. From her presentation, we learned about the risk and issues faced by our Filipino children during this time of the pandemic. So this include issues on nutrition and physical health, education, mental health, special needs, and safety and security. She said that children's risks of being infected with the COVID-19 is relatively lower than other age groups, but it cannot be denied that the pandemic increases their vulnerability to the risk that she has mentioned. So I hope that you took note of the recommendations that she shared with us. She had recommendations on health and awareness, mental health, education during health emergencies, children's safety in their physical and virtual environment. So before we proceed, let me just announce that we will be sending you the presentations of our speakers, including the points raised by Ms. Jean Enriquez earlier. So at this juncture, we are ready for the reaction. Our reactor is the director of the Child Protection Unit of the University of the Philippines, Manila, or the Philippine General Hospital. She is also a clinical associate professor of pediatrics at the UP College of Medicine. She is also the executive director of the Child Protection Unit Network. This is an NGO that supports the training of child protection professionals and the development of child protection units in the country. She is a past president of the Philippine Ambulatory Pediatric Association. She has been awarded as one of the outstanding women in the nation's service in 2001. So, ladies and gentlemen, please welcome our reactor, Dr. Bernadette Hardiolin Madrid. Dr. Bernie?
Yes, thank you, Don. And congratulations to Christine for such a comprehensive presentation of the effects of COVID on the children in all aspects and some proposed solutions for these identified problems. So what I'm going to do is to further expand the solutions to the problems posed by COVID on children using child protection as an example because the challenges in child protection are also challenges that is going to be faced in the other sectors like education, mental health, physical health of the children. Overall, what we must remember is that the problems already existing are further aggravated by COVID. So these problems are already there. And what COVID does, it makes it worse. And if services that were missing before COVID, they will still be missing now. Okay. And then COVID brings in other new problems. So what should we do? Okay. Just a brief overall picture. We do know that violence against children is very high. And this national baseline study on violence against children shows that 3 out of 5 were physically and psychologically abused and bullied. 1 in 5 were sexually violated. and more than half experience at least two types of abuse. So if you have experienced one form, you're in danger also or at risk of experiencing other forms of abuse. And right now, with so many things going online, we see that cyber violence, is which is already a problem before COVID, with 44% of the children having undergone some experience of cyber violence. So with COVID and everything going online, we expect this to be even worse. We also know that when there are disasters, violence increases threefold. This was also shown by that violence against children study. And COVID, certainly being a pandemic, is one of the worst forms of disaster that we have ever experienced. So much so that some even call it this is the third world war. Now, uh, will it increase violence against children? When we look at other countries like India, we see that there is this 92,000 calls on child abuse in 11 days. And so I asked my friends in India involved in child protection whether this statistics is true, and they said yes, that's true. So of course the question, the other countries report the same. That's why the UN chief, Antonio Guterres, is saying that there is this horrifying global surge in domestic violence, especially related to lockdowns imposed by governments responding to COVID 19. So the question is, do we show the same type of violence reports in the Philippines? If we look at this Bantay Bata report, comparing before ECQ and the month of the lockdown, just 1 month, we do see that there is an increase. Maybe not like India, but certainly an increase. But we also note that the increase is not the same for all forms of abuse. Very glaring here is the big increase in physical abuse. And I think that could be explained because when we look at again this violence against children baseline study, we see that majority of physical abuse happens in the home, and with lockdown, everyone is at home. So it makes sense that physical abuse, which was already high before COVID, will be further aggravated by the lockdown. Now, who are the perpetrators? We see here that the perpetrators wherein the child was hospitalized because of severe injuries. Number one was the father. So they're all together at home with the increased stress, with increased unemployment, with the frustration, the anxiety, and other things brought about by COVID. And you will see that there will be an explosion in physical abuse because of all of those factors. How about sexual abuse? Should we also expect the same increase in sexual abuse? Well, here we could see that in terms of settings, there is almost an equal percentage between the home and dating. However, people, teenagers do not date during COVID because they are in lockdown. So we will expect that dating violence will not be increasing. But the home violence, again, because they are at home, we will expect that to increase. Well, school, there's no school. So you don't really expect that. Community depends, especially since there are also like bans in getting together and there is alcohol ban. I think alcohol ban helps. Okay. So who are the perpetrators that we see of child sexual abuse during ECQ? They're the same perpetrators. But missing in the top is father. Now, when we talk about incest, if everyone is at home and it is a one-room affair, it's quite hard to do incest when everybody's watching. Okay, so maybe incest, we will not see an increase. Maybe it's the same, or maybe even a decrease. But there are other forms that is brought about by COVID, new dangers. I think this has been mentioned also by Michelle and Jean. For example, because of quarantine, and there are breakers of quarantine, and they are also put in jail or somewhere, So this is what happened to Fabel Pineda. So because she was caught out of the house breaking quarantine, and she was put someplace by the police officer, she got raped. And when she reported the case, going home, she was killed. Okay, so these are the unintended consequences of the lockdown. What is the explosion is the increase in online child sexual abuse. The Department of Justice has reported that there is a 264% increase in the country with regards online child sexual abuse. And this report comes from the National Center for Missing and Exploited Children in the United States. But they could see that, as usual, we are notorious for being the hub for online child sexual exploitation, and this has gotten worse with COVID. Everybody home. And together with the online, aside from sexual abuse and exploitation, we also have online gambling, okay, and accessing pornography, cyberbullying, okay, all of those increasing, okay. So do we see increasing reports because of this? Well, when we look at the statistics of the women and child protection units in the hospital, we find that in the first month of lockdown, there was a big dip of reports brought or victims being brought to the hospital for many reasons. One of which, there was no transportation. Second, they're afraid to go to the hospital because they think they might get COVID. And third, there were some WCPUs, Women and Child Protection Units in hospitals, that were closed because the services were all centered around COVID. So that's why some women and child protection units had to go out of the hospital. Here in Bataan General Hospital, the governor helped them have a tent outside the hospital so that the patients or the victims will not be afraid to seek consult or treatment because they're separate from the hospital. I think it must be recognized that services for women and child survivors of abuse should be labeled as essential services during COVID because they are the collateral damage of the response to COVID. Here also in Batangas Medical Center, you see they have the tent also outside the hospital. We also have hotlines now for COVID and to increase information and to increase access for survivors of violence. For example, the PGH COVID-19 Bayanihan Operation Center also serves as a hotline not only for COVID, but also for survivors of violence. So they can call the same number and we're going to also enable the other women and child protection units in 60 other WCPUs to have their own hotlines. We have this interactive WCPU directory in our website where anyone can enter where they are and they can identify where the nearest women and child protection unit is located, and they could call the unit to ask about services. Aside from that, we also have to think about how we will protect our health workers and patients from COVID itself. So that's why staff and patients who are seen at these units also need PPEs. So that should be part of the budget. And when schools open, uh, these same considerations should be there. So how do you protect the students? How do you protect the teachers? Should they be wearing PPEs? At the very least, masks with face shields. Now that we know that COVID can be spread by the air, we, aside from mask, we do need face shields also. But it's a good thing that face shields now are getting cheaper It's now 25 pesos. You can buy a face shield, but it's a consideration for everyone in terms of face-to-face interaction, be it in health, education, anywhere. You need to consider having these PPEs. We have also digitalized service in the sense that we now offer telemedicine at the PGH Child Protection Unit for follow-ups, again, to decrease face-to-face interaction. And we are also going to enable the other WCPUs to be able to do the same. Now, of course, you're going to say that, well, that's only for those with access to computers and smartphones. I think that the rich and poor divide, as well as the digital divide, will even be wider with this COVID. But we are going to do something about that too. A little later, I will mention it. Even court hearings are now online. So we testify instead of going to court, we do it online. And in fact, we like it better because you can still do something else while waiting for your turn to testify. In terms of case conferences, again, this can be done via Zoom instead of doing face-to-face conferences. So like right now, our webinar is by Zoom. um, Social media, we can spread information. In fact, these parenting tips to decrease physical violence, we spread it with the use of social media, and it's very fast in spreading. In fact, in just a few days, you can reach 39,000 people. No. Same with using Viber, WhatsApp, of course, so long as you have internet access and a smartphone. Now, we also realize because it's very difficult for survivors to reach places of help because of no transportation or because the frontline workers are all involved with COVID. We realize that more and more the importance of what the barangay can do. So that activation, this DILG memo with regards activation of VAUSI desks in the barangays is very important, because now in terms of being right there where the victims of violence are, we need to train just like what Jean Enriquez and her team is doing in Mindanao, that needs to be replicated all around the country. We should enable the barangays also to join this digitization of services. So at least in NCR and Cavite, we are going to enable the barangays, some barangays, especially the hotspots, to be able to have the capability for us to deliver our services through them with the use of telemedicine, teleconsultation, even the online court hearings. So we will see how and help the barangays to be able to do that. Hopefully, we hope that the cities will be able to provide internet access for all. I mean, that can be done. And for those who don't have digital, don't have the means and the capability for digitization, their old methods can still be adapted to the new normal. Home visits still, but with proper equipment for safety. You distributing flyers and leaflets for information, even together with food distribution. Even the use of megaphones to do for information sharing, and the barangay radio. All of that could be used for us to be able to help disseminate very important information for all the barangay people living in the barangay. Okay, so I will stop there so that we will have time for open forum later. And thank you for the opportunity to present this. Over to you, Don.
Thank you, Dr. Madrid. So let me just share with everyone some of my notes here. Dr. Madrid said that the violence increases threefold during the pandemic, and she gave us warnings. Here are some. Dating violence may not increase during pandemic. School violence may not increase, but we should be all mindful that home violence may increase during the pandemic. There are new dangers brought by the quarantine, one of which is rape and online sexual abuse. She mentioned a few good practices in local government units. One is done in Bataan and another in Batangas. So I hope our provincial local government units and even our municipal and city government units can learn from these experiences. She also mentioned that digitizing services are part of the new normal, but she also warning that this can create a divide between those who have access and those who do not have access to these services. And she's hopeful that barangays, city, and municipal governments can do their share in delivering these services to our citizens. But she also said that if they don't have the capacity, then maybe our local government units can still resort to the old methods of delivering these services. So with that, I think we are ready for our question and answer. I will be reading questions sent to us during the registration period. And if we have time later, we shall entertain questions from the chat box. Again, due to time constraints, we may not be able to answer all of the questions collected during the registration and collected from the chat box. So let me start. So to our speakers and our reactors, feel free to answer the questions and share your insights. Okay, our first question will be coming from Miss Shirley Maraya, instructor at the UP Visayas Tacloban College. I think this question can be answered by Ma'am Mitch. What is the rubric or the set of assessment indicators being used to ensure that local COVID management is gender responsive? Again, what is the rubric or set of assessment indicators that are used to ensure that local COVID management is gender responsive? So maybe Ma'am Mitch or Miss Jean can answer the question. Let's have Ma'am Mitch first.
Okay. Thank you, Sir Don. And thank you. I hope na yung nagtanong ng question ay nandito. But I think may similar question din from the chat box on how we can assess ano yung pwede nating magamit na rubric or indicators that will tell us that our government response or LGU response are gender responsive. Ano? As I mentioned a while ago, may mga tools po, materials, references from the Philippine Commission on Women that we can use mula dun sa development ng projects and programs hanggang sa implementation and then sa evaluation. So, yung una nga po dun yung HGDG, ayan, yung HGDG ay meron po siyang comprehensive checklist. Naka-specify po dun anong klaseng project, tapos anong klaseng checklist yung mag-a-apply sa project na yun. So, meron silang insert na specific siya for DRRM response and nakalagay doon yung iba't ibang elements na that will tell us that a particular program or project is able to consider the gender dimension. So, yun din po yung ginamit ko na basihan doon sa survey that I shared with you a while ago. And basically, if we can summarize the areas that were looked at doon sa mga checklists na yun, nandun po yung participation ng mga kababaihan. So, na-consult po ba yung sector na magiging recipient or stakeholder ng proyekto or ng programa. So, gumamit po ba ng sex disaggregated data doon sa analysis ng situation, ng problem, or ng gap na kailangang i-address ng polisiya? So, gumamit din po ba ng gender analysis, yung gender analysis tools, yung mga developer, yung pag-develop, doon sa pag-develop ng polisiya or ng programa. And then, involved po ba doon sa delivery ang mga kababaihan? So, dito po sa mga gender analysis tools na ito, sa mga checklist na ito, hindi lang po whether participant or recipient, hindi lang po binibilang yung kababaihan, kalalakihan na naging recipient nitong mga programa, kundi naging natanong ba sila, nakonsulta ba sila, kasama ba sila sa implementation, and then during the evaluation, na tanong po ba sila kung talagang na-meet yung mga outcomes and objectives itong programa in terms of their experience receiving the services and the public service that was supposed to be given through the project. So again, participation, gender analysis, and then yung specific na mga gender needs. Kaya very important yung gender analysis para ma-identify po natin ano yung mga gender issues, ano yung mga specific na mga pangangailangan ng mga kababaihan at ng iba pang mga genders pagdating po dito sa COVID-19 na pandemic na ito. So, yun po. I hope that answered the question.
Okay. I think some of our participants are more familiar with the terminology Hagadaga than
Hagadaga, yes.
HGDG. So HGDG or Hagadaga, they are the same. May we ask the thoughts on this matter of our reactor, Miss Gina Enriquez? Ma'am Jean?
Hi, Don. I won't comment na para we can entertain more questions.
I
Tingin ko
see,
sapat na
okay.
yung kay ano. Thank you.
I see. Okay. Okay. Our next question maybe can be answered by Ma'am Marie Chantayo and Dr. Bernie Madrid. I just hope we have a child psychologist or a childhood development expert sa ating participants. But for the meantime, maybe our speaker and our reactor can share their thoughts on this. The question is, how to cope with fear and depression when one of the children's family member died with COVID-19. Again, the question, how can children cope with fears and depression when one of their family members died with COVID-19? Let's have Ma'am Marie first.
As mentioned earlier in my presentation, siguro yung proper communication sa bata on yung being honest with them, ano yung COVID, then what's the risks, could actually help them na, yun nga, kung sakaling magkaroon sila ng family member na maging victim ng COVID-19, it would parang mas malilesen siguro yung sadness nila. Kasi alam na nila yung risks na nung sakit eh. So, baka that would lessen the depressions siguro.
Okay.
Yes.
Doc Bernie, will you add
Ma'am,
something?
Yes. In general, mental health problems really increased during COVID, not only for children, but also for adults.
Yeah.
And so many people have lost a relative, a friend, because of COVID, and they are grieving. Now, grief and being sad is normal. No? So it should not immediately be looked upon as a mental health problem, because everyone should undergo, if you really lost something you valued, you should undergo grief. You should grieve. So first of all, the parents should accept that their child is sad and they themselves are sad, and so no, and then how that family copes with the grief is also very important. So there are many ways that families cope with grief. It could be through prayer, through being together, or having good memories about the person that died, and also the reassuring the child that they are there for her and or for him. So being more together, although of course people are more together now than usual because they are all locked down, so having other activities together that are maybe ceremonies of saying goodbye. Okay, but if this grief continues for months, iba na yun, hindi na normal yun. And that will need already psychological help, in terms of that's not anymore normal grief. Pero kung it's just recent and that it's normal to grieve, no? So isang problema natin right now is about access to psychological help. So more and more I see telemedicine, how to access psychologists offering telemedicine. And you know what? I think that's one maybe that's one thing that we could also organize, no? I'm looking at how counselors be band together to offer services for those needing this because of COVID. I see a lot for health professionals, but for ordinary people, parang halos wala akong nakikita. So I think that's also a needed service at this point.
Okay, thank you very much. Let's proceed to the next question. And the question is, okay, gender-based violence has been particularly high during the lockdown period in the country. Do you know any efforts done by local government instrumentalities in addressing such? So I think Ma'am Mitch has answered this in her presentation, but I can see a lot of similar questions. So maybe this question has to be, this issue has to be elaborated further. Again, gender-based violence has been particularly high during the lockdown period in the country. Do you know any efforts done by local government instrumentalities in addressing such? Follow up to that, a Bloomberg article shows that women have higher unemployment rate than men in the US in April 2010. Do you think we have any similar data or update on this here in the Philippines?
Okay.
Question came from Nenita Taasing, a graduate student of UP Diliman.
Okay, thank you po Sir Don. And again, I hope na yung nagtanong ay nandito, and if not, I probably marami rin po ang may similar question. May ano po ba yung mga efforts, concrete efforts ng mga LGUs natin? Tama po ba yun yung una, concrete efforts ng LGUs? And then second,
Yes, Ma'am
sorry, what's
Mitch.
the second question?
Tungkol sa unemployment ng women.
Okay,
So,
okay.
do you want me to repeat the question?
Sige po. Okay,
Okay.
I think I got the unemployment question. So,
Okay.
in terms po again of addressing cases of gender-based violence and domestic violence, dun po sa mga guidelines na na-discuss natin kanina in the recommendations, LGU should ensure yung survivor-centered na approach, VAUSI desks, referral system, yung mga services na ino-offer before, dapat patuloy siya na i-offer. Nabanggit nga ni Dr. Madrid, dapat i-tag yun as essential na services. Because isa to sa mga, it's a shadow pandemic na kailangang i-address ng government natin. So in terms of the concrete actions, the survey I shared with you a while ago, we asked them, yung mga sumagot na 20, kung lahat ba ng VAUSI desks nila ay open, tapos kung nag-set up ba sila ng mga additional hotlines para sa mga nais na magsumbong ng mga cases ng VAUSI. So 19 out of 20 said na lahat open yung VAUSI desk nila. Yung isa na nagsabi na hindi open, nabanggitan natin yung reason kanina kasi yung effort nila was poured dun sa distribution ng relief assistance sa kanilang mga constituents. And isa to sa mga challenges, yung lack of personnel na pwedeng mag-man. So, nireiterate po dun sa joint memo circular ng CHR tsaka ng DILG, dapat magpatuloy ito na i-offer pa din ng ating local government units. Tapos yung hotlines, 19 out of 1 ang nagsabi, 19 out of 20 ang nagsabi na meron silang hotline. Hindi nag-specify bakit hindi open yung isa. And then they also shared some innovations that they did, no, para ma-address din yun, matulungan, magkaroon ng concrete action para dun sa mga naging survivors or biktima nitong gender-based violence. Like in QC, they provided financial assistance, ayun. Tapos yung mga shelters, open yung shelters nila para dun sa mga nangangailangan ng immediate na rescue mula sa kanilang mga abusers. And then for the second question, pagdating po sa employment, actually, mas mataas po ang unemployment rate sa mga kalalaki. Basta mas marami po sa mga unemployed na Pilipino ang lalaki compared sa babae. But it doesn't mean na, okay, mas well-off pa rin ang mga lalaki compared sa babae. Because as we mentioned earlier, malaki ang epekto kapag yung mga babae, at marami sa mga kababaihan ay maraming economic insecurity at dependence, lalo na sa mga gumagawa ng unpaid care work or unpaid homework, sila economically dependent sa mga kamag-anak nila na sumusweldo or dun sa kita ng negosyo nila or ng farm nila. And so yung unemployment ng mga kamag-anak nila, that will mean na mababawasan yung kita ng pamilya. That will also mean na mai-increase yung economic insecurity ng economically dependent na babae. And so yung snowball effect na yun para sa kanila ay mas magiging pronounced. Ayun po.
Okay, thank you very much. Ma'am Jean, can you share, would you want to share something?
Oo, very crucial lang. I cannot overemphasize the need for VAU desk officers ng mga barangay po ninyo sa mga local governments na mag-undergo ng survivor-centered training. Survivor-centered and gender-responsive approaches to all forms of gender-based violence. So we can do teletraining on this or online training on this. Kaya mahalaga po na hindi lang aktibo sila kundi alam nila paano mag-respond. Mahalaga rin po that we make available our transportation resources kasi yung safety po nila, yung kaligtasan ng buhay ay pinakamahalaga. Maitakbo sa ospital, immediately yun pong mga nag-suffer ng iba't ibang forms ng gender-based violence. And yung kanila pong mga supposedly pagka public hospital, ideally sana nga may kagaya nung kina Dr. Madrid na protection unit so that they can be properly referred also to other services. No? Pero unang-una po yon na mahalaga na matiyak na sila'y malapatan ng kaagarang lunas. Kaya dapat available po sa ating local governments yung transportation. Kaugnay po ng training, hindi kailangan lagi yung shelter. No? At marami po tayong local governments na walang shelter kasi nascan na rin po namin sa buong Pilipinas. Bihirang-bihira po ang may shelter sa local governments. Kaya kailangan alam din po natin yung batas, hindi dapat yung mga biktima ang umaalis dun sa kanilang bahay, kundi yung perpetrator. So ilan lang po yan, pero mahalaga yung comprehensive training na amin pong binabanggit. Thank you.
Okay. Ma'am, follow-up question po. Do you know of any organization that can help local government units in providing these survivor-centered trainings that you mentioned?
So bukod po sa aming organisasyon, Coalition Against Trafficking in Women, yung iba pong mga kasama namin sa National Gender and Development Resource Pool ng Philippine Commission on Women. So kontakin nyo lang po ang PCW, i-refer po nila sa amin kung sino ang available sa aming nationwide na resource pool.
Okay, so ayun, to our dear participants, you may contact the PCW daw and PCW will contact the organization of Miss Jean Enriquez.
And
Okay,
also, Don,
yes po.
we are opening our online training for women and child protection, specialty for social workers, registered social workers, for LGUs, for those who directly manage women and child abuse cases. So we will be, the training will start on August 14. It's an online training. And they can contact our office at the Child Protection Network. I will just write the telephone number here in the chat box.
The chat box. Okay, so Child Protection Unit, Network.
Child Protection Network Office 84043954.
Okay, so everyone, please open your chat box and look for the numbers there. Okay, let me proceed to the next question habang may oras pa. So, nabanggit nyo ng mga to sa mga presentations nyo, pero marami pa rin questions on this. So baka nga kailangan. On children naman, what PPAs or what programs, projects, and activities can you recommend to the local government units and the barangays in terms of gendered approach and protection of children in time of COVID-19 pandemic? So what PPAs can you recommend to the local government units and barangays in terms of gendered approach and protection of children in time of COVID-19 pandemic? So maybe from the experiences that you mentioned, maybe you can choose one and recommend to our participants.
That's for the children siguro. Baka yung like SK and DCPC, yung sa akin, yung na-mention ko kanina sa presentation, they could go house to house.
They could go house.
Yes, para mas, dahil nga para mas makita nila kung ano talaga yung nangyayari sa bahay ko. Ano yung immediate need, lalo barangay level, mas
Yeah.
maliit, tas collective information din. They can bring up to the city or municipal level.
Tsaka din para maiwasan siguro yung pila sa ating mga
Yes,
barangay
oo.
and ating mga local government offices. Dr. Bernie, are you going to share something?
I was busy typing. Sorry. If the question is about good practice
Yes po.
for the barangays.
Barangays and even city and municipal and provincial government units po.
No, we are actually also going to do barangay training for our hotspot barangays. The one that I talked previously, so that they will have the capability for telemedicine, teleconsult, online court hearing. And so we're hoping that the barangays that we approach, because that's where we have our highest statistics, will agree to participate, because then it will bring services right there in the barangay, instead for them going to hospitals or somewhere else. Pwede na nila ma-access through the barangay. But it comes with the training program, because barangay VAUSI officers should also know how to handle these cases, no? Because first, to recognize when what is abuse, how it manifests, and then how to do at least the first line case management for these survivors. So we are going to do that with them.
Okay, thank you very much. The Child Protection Network Foundation Office telephone number is 840-43954. So you may reach the office through those numbers. Ma'am Mitch, are you going to share something also?
No, wala naman.
Wala na. Okay,
Oo.
next question. This came from Miss Paulina Naira of Weavers, Women Enablers, Advocates, and Volunteers for Empowering and Responsive Solutions. She's the president of Weavers. So the question is this. Majority of the health workers are women, and most of them are providing unpaid care work in the communities, and their responsibilities during the COVID crisis has aggravated their multiple burden with school children at home 24/7 and husbands who have lost their temporary jobs. So what support are being provided to women frontliners, especially the community health volunteers during these times? Are you familiar with any support given to this group, Ma'am Michelle?
Okay. Honestly, pagdating po dun sa specific na mga concrete projects ng LGUs, I don't have much information there, but siguro let me just emphasize, especially na marami po tayong LGUs na participants ngayon, itong multiple burdens po na hawak, especially ng inyong frontline workers. I'd like to reiterate yung sinabi ko kanina na please support them, provide them with complete PPEs. Ito, personal observation ko po ito. I am doing this webinar from Pangasinan. Kakauwi ko lang po sa isa kong LSI actually. At nung isang linggo, nung kakauwi namin, nag-report kami sa barangay, and the members of the barangay health emergency response team, who are actually barangay health workers, visited us. So dalawa po silang nanay. Tapos, so syempre we had interviewed them, nagkwentuhan, and then they shared na okay, wala silang kompletong PPE. Actually, they were wearing mask, pero the fabric type. And as Dr. Madrid said a while ago, COVID is airborne. Pwede na po siyang mapasa sa hangin lang. Hindi lang siya basta talsik lang ng laway. So, very important na yung protection ng health workers natin ay pagtuutan natin ng pansin. Sabi nila hindi sila binibigyan ng masks ng government, kanya-kanyang bili. So nakakalungkot po yun na marinig, kasi sila yung isinasalang, sila yung gumagawa ng legwork at sila yung exposed. And then our barangay health workers, they're the ones doing the legwork, but they receive very, very little allowance nga. Hindi sila, di ba, hindi sila regular employees. So, all the benefits of the regular government employees, they do not receive them. So, sana the LGUs can provide for that. Give them the appropriate hazard pay, additional allowances if kaya po ng pondo, support them, provide them PPEs, transportation, and again, yung sa facilities na temporary shelters for them, sana po bigyan sila ng women-friendly na facilities and support sa transportation. And consider providing them, again, practical assistance. Like, if they do they're still responsible for taking care of the household, their children. Probably the LGUs can again provide practical support, like bringing the services nearer to them. Like yung mga na-survey namin na LGUs, they shared that yung mobile palengkes that they did at the start of the community quarantine, actually ano siya, para siyang win-win solution talaga kasi syempre alam natin nung time ng community quarantine, bawal mabas, mahirap bumili ng mga needs, tapos limited lang yung pwedeng mamalengke sa bahay kasi kung sino lang yung may quarantine pass, tapos nagkaroon ng curfew, so hindi yung dating operating hours ng mga palengke and even ng mga grocery stores na limitahan, ano. So, yung kanilang mga mobile palengkes, yung kanilang mga mobile talipapa, nakatulong yon para yung mga nanay hindi na kailangang lumayo sa bahay nila, hindi na kailangan ng quarantine pass para makabili. And then it also helped those local farmers, women in the informal economy to earn a living kasi sa kanila kinukuha yung mga products. So those kinds of initiatives from the LGUs, they address several of the cost-cutting issues affecting our women. So hopefully more LGUs can do more innovations. And again, support your frontline workers, especially our barangay health workers. Part po sila ng ating public health system at madalas po ay neglected sila. So, ayun po.
Okay.
Don, I just want to add
Yes po, Doc.
that our COVID situation right now is really worse, even worse than April, and that there are so many health workers who are ill with COVID right now, both doctors, nurses, etc. Such that if you ask doctors right now if they, especially in NCR, whether they would recommend ECQ again, they would. It's how bad it is. So this protection that we're talking about, that is very important.
Okay. So maybe our local government units can also explore possible programs that would help our frontline service providers during this pandemic. Kasi sila po yung kailangan nating maprotektahan din sa mga panahong ito. Okay, for the information of those who are posting answers on our chat box, we will try to answer your questions via email. So don't worry, masasagot pa rin naman po ang inyong mga katanungan. We don't have much time, but let me just ask this last question to our speakers and to our reactors, because we have been talking about protecting and safeguarding women and children in times of during this crisis. But itong question naman na to, babalik ta rin naman. What is the best contribution of women and children during this crisis? Again, what is the best contribution of women and children during this crisis? Yung iba nagtatanong din, what are women's role during the crisis situation? So pareho lang. Again, what is the best contribution of women and children during this crisis? So maybe we can have Ma'am Mitch first, followed by Miss Jean Enriquez, Ma'am Marie, and then Dr. Bernie.
Okay. So nabanggit ko rin po kanina during the sharing a while ago na ang mga kababaihan ay hindi lang po sila recipients, hindi lang po sila stakeholders. They can take the lead, they can participate actively, at kailangan po na marinig yung boses nila ng LGUs natin. And many women are also leading our LGUs. Women's groups are participating, augmenting the efforts being done by the government, like the group of Ma'am Jean. Ayan. So ang mga kababaihan po natin ay hindi lang po sila kailangang protektahan, hindi lang po sila kailangang i-safeguard as if they're weak, as if we are weak. We are partakers. We are, as I said, ang ating frontline workers, majority are actually women. So if you're asking for the contribution of women, that's it. They are at the front line of fighting this pandemic. pandemic, ano? And even in the other aspects of the government response, they're there. And siguro, again, ang kailangan lang ay mas pagtuunan ng pansin yung kanilang participation, yung kanilang needs, lalo na sa mga again, frontline workers. They're the majority of the frontline workers, the women, but some of them are, the needs are not being heard, and the gender aspect, the gender dimension of the response, kulang pa. So let's do more on that part.
Okay. Yes, Miss Jean.
Nasabi na ni Mitch, no? Primarily, syempre sa health workers natin, but even the very poor women, they have been building solidarity economy with the very few resources that we were able to share with them. Nag-start sila ng kanilang mga collective economic livelihood. Thank you.
Okay, Ma'am Marie.
Para sa mga bata, well, yung mga bata lang literal talaga na bata, ang pinaka pwede nilang gawin is to stay at home. Obey their parents. Huwag nang makulit na lumabas. Follow safety protocols. And para naman dun sa mga medyo edad na bata, they can educate themselves. So, do research about COVID. Then and of course, be mindful din sa mga sinishare nila online na information about COVID. Lalo, maano rin na sila sa social media. And for our youth leaders, yung SK, na yun nga, do more research, collaborate with their barangay officials para they can have more programs for the protection ng youth and children sa community.
Okay, thank you. Dr. Bernie?
Yeah, I think also it's not only women participation that we need to advocate for in terms of leadership. We should also advocate for child participation in terms of leadership, even participation in making policies and what can be done even in the barangay level. Children can participate in that. So dapat the children in the community should also ask how they can participate in this in the leadership within the community. So isa yan. And number two, of course, because they're staying at home, self-protection in terms of so that there will be decrease in exploitation of children online, and how to do activities at home and be more creative. Pwede rin actually, the children can do many things. Okay.
Okay, thank you very much. So we still have some questions left unanswered, but in the interest of time, we shall now end the question and answer. As I mentioned, other questions that were written in our chat box and sent to us during the registrations, we'll be answering those questions through our email. So all relevant email addresses and pages will also be shown on your screens at the end of the webinar. So again, we would like to thank Ma'am Mitch, Ma'am Marie, and our reactors, Ms. Jean Enriquez and Dr. Bernadette J. Madrid. Congratulations also to our participants who have reached this point of the webinar. So as a token of our appreciation to our reactors, we'd like to present them these certificates. So let me first read the content of the certificate. University of the Philippines, National College of Public Administration and Governance, Center for Local and Regional Governance awards this Certificate of Appreciation to Ms. Jo Enrica Enriquez for sharing her invaluable knowledge as reactor during the webinar on Women, Children, and Health Crisis Management at the local level held on July 31, 2020. This certificate is signed by CLRG Director Alicia Celestino and NCPAG Dean Dan A. Sagiel. So thank you very much to Ms. Gina Enriquez.
Thank you so much. Magandang hapon po.
Same certificate is also awarded to Dr. Bernadette J. Madrid. Dr. Bernie, thank you very much for joining us this afternoon. Hope to be with Dr. Bernie and Ms. Jean again in our other webinars in the future. Again, thank you very much to the two of you. And our sincerest gratitude. And good luck also to all your endeavors during this crisis. And stay safe po. And our director has been trying to connect to our Zoom, but she could not, and so we will not be hearing her closing remarks. So before we end this webinar for the last time, may I request everybody to please turn on your camera so we can have a group picture. So everyone, please show us your sweetest smile and consider this, as I said, our group picture. So let us give our technical support team maybe 1 or 2 minutes to take our photo. So still show us those winsome smiles. Okay, last 30 seconds according to our technical support team. Okay, I think that's okay for our group photo. Here are some final reminders to our participants. Certificates will be given not earlier than 7 working days after this webinar. Certificates will be given only to those who complied with our requirements. Number 1 is registration. Number 2 is participation via Zoom, via the CLRG website, or via the CLRG YouTube channel. The feedback form is available only until Monday, August 3 at 5 p.m. So please make sure to answer the online feedback form. After August 3, 5 p.m., the online form will no longer accept responses. If your Zoom email is different from the email that you used during the registration process, please inform the webinar managers so we can match them accordingly. If you will be posting pictures of your certificates, please make sure that you blur the signatories and other private information on the certificates. And lastly, please share with us your thoughts and comments on the webinar by answering the feedback poll. You may click on the link provided in the chat box, or you may scan the QR code on your screen. Again, you may click the link in the chat box or scan the QR code on your screen, and those will lead you to our online feedback form. You may answer now or after the webinar. Just make sure that you're able to copy the link and paste it on your browser and send your answers before August 3, Monday, 5 p.m. Again, click the link in the chat box or scan the QR code. So for other webinars in the future, please check the schedule of the webinars that the CLRG will be offering this year. You may send inquiries to our email or our Facebook page. Lastly, please follow us on the sites and pages flashed on your screen. So there you may follow us on our website, our Facebook, our Twitter, and our YouTube channel. So please do not forget to like, comment, and subscribe. In behalf of the NCPAG Dean, the CLRG Director, the CLRG staff and interns, our speakers and our reactors, this has been Don Jeffrey Cabral wishing you a wonderful weekend. To those in the Muslim faith, may you have a meaningful Eid al-Adha celebration today. So everybody, see you all in our next webinars. Thank you very much.